So that we start, because this room also has pressure on it because of the closing ceremony that we anticipate. So kindly call your colleagues, just come and settle in so that we can start. There's just a few technology issues. Can we have this monitor on? Yeah, this central monitor, if it can get on, then we should be able to start. I would also like to request that perhaps we test some of the presentations that are there so that we can proceed with today's session.
How are you? You know how to use OBS? No? So I used the hotkey.
There's supposed to be some videos running. Could you kindly run those, because we may not have a separate time slot to run them. And let's target to really start at 2:40 p.m. In order to catch the time that we have. So could we also, the IT team, could you also test this gadget, the prompter, so that we make sure it's working?
It's not like yes. Some goes in another still switch.
have not finished at all.
So would really like to start at 2:40. The only thing that I haven't seen is testing the slides and with this prompter. So can we have that done?
Over the past 4 years, we have worked relentlessly to address sexual and reproductive health rights, SRHR, and as I reflect on the journey of Amref Health Africa's Heroes for Gender Transformative Action program, I am filled with pride and hope. Over the past 4 years, we have worked relentlessly to address sexual and reproductive health rights, SRHR, and sexual and gender-based violence, SGBV, in 9 high-burden districts across Uganda: Kalangala, Iganga, Namayingo, Bujiri, Budaka, Mbale, Mayuge, Kwen, and Bukwo. Back in 2019, the statistics were alarming. 1 in 4 girls aged 15 to 19 was either pregnant or had already given birth. Nearly 24% of girls were married before the age of 18. Access to SRHR services remained limited, leaving many young people vulnerable. Determined to make a difference, we launched a program guided by World Health Organization's best practices and health and human rights framework. Since then, we have reached over 500,000 young people with comprehensive sexuality education through structured curricula like Journeys Plus and Program Y. Beyond school, we have engaged over 10,000 out-of-school youth through community dialogues and medical outreaches. But education alone, not enough. Strengthening health has been at the core of work. In partnership with 65 health facilities, we have trained 1,500 health workers on basic emergency obstetric care, BMOC, customer care, and inclusivity. Additionally, over 500 community leaders have been equipped with leadership and accountability skills to champion RHR.
Thank you. So I'd like to take this opportunity to welcome all of you to this prior session 1, which is concerning eliminating gender-based violence for safe motherhood. This afternoon, we are really tackling a very important matter that needs a multisectoral approach to address and making sure that it is tackled holistically. We have indeed a very good panel, and I'll be your moderator. I'm Dr. Patrick Agurusi. I'm the country manager for AMREF Health Africa in Uganda. I want to take this opportunity to thank all of you for coming. As you may be aware, Sustainable Development Goal 5 aims at reducing gender inequality and empowering women, girls, and whole societies to have an essential foundation for a peaceful, inclusive, and sustainable development. The National Development Plan for itself, for Uganda, recognizes that gender equality and women's empowerment is central to accelerating socio-economic transformation. And safe motherhood is really part and parcel of this whole agenda. So this afternoon, we have a very interesting panel that will try to expose the root causes, the solutions that we will work on together. The panel with you will have a deep conversation on how we need to address these challenges and how we need to work together. I'm also pleased that within this forum, we also have a top religious leader who will also give us perhaps the religious perspective. So without much ado, I would like to take the opportunity to invite our panelists to come and grace this function and also actually present on the different areas that we'll be discussing. First, on the podium, I'd like to invite Madame Juliana Lukuzi from UNFPA. Please come and take your seat right here. Second, I would like to invite Madame Judith Adokorach from the Netherlands Embassy in Uganda. I also would like to invite Madame Angela Nakafero, Commissioner for Gender and Women's Affairs at the Ministry of Gender and Labour Social Development. I would like to invite Dr. Irene Mwenyango, the Acting Commissioner for Adolescent Health at the Ministry of Health. Okay, as we wait for her, and Henry, please follow up. I would like to invite Ms. Fatia Kanyange. She's the Executive Director at SEHAT. I would like to invite Mr. Henry Semakula from the Ministry of Education. We are happy to have you. And I'd also like to invite Madame Harriet Nekesa, the Community Development Officer, Mbali. Please come and also join us to share with us those experiences. So the agenda for this afternoon is that we'll receive a keynote address from UNFPA, and then we shall go through several questions based on what we prepared to discuss these topics, and thereafter we shall have a panel discussion and conclude with engagement with you in the plenary. So you are very welcome, and it's now my singular honor to invite Madame Juliana to come and take the podium and give us the keynote address.
Oh, okay. 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 Thank you, Patrick, our moderator, and good afternoon, ladies and gentlemen. I know that you're not loud enough. We've just eaten. Good afternoon, ladies and gentlemen. That is better. And as Patrick says, I'm Juliana from UNFPA. My role at UNFPA, they call me, I'm the team lead for sexual reproductive health. But the first title starts with what we call integrated sexual and reproductive health and rights. When you look at the issues of rights, that's where we now get to think about the whole issue of GBV. I know when it comes to gender-based violence, some of us who work in maternity ward, I think we just want to go there, see a pregnant woman deliver, we are happy. As a midwife, I've been just like most of us midwives. You go to the labor ward, you hardly think about the psychological component of the woman. This woman who is coming in labor ward, yes, she's looking healthy, but is she happy where she's coming from? Did she get pregnant because she wanted to get pregnant? So today we want to talk about the silent issue when it comes to women who are pregnant, the whole issue of gender-based violence. The first thing that we need to think about in SRHR, we want to teach our midwives, those doctors, those paramedics who are in the labor ward, that when you're looking at a woman, we need to go beyond the pregnancy. And we need to think, did this woman get pregnant because she wanted to get pregnant? So when it comes to gender-based violence, and just in setting the stage, I want to emphasize one thing, that behind every statistic is a woman, a family, and a future. And when it comes to safe motherhood, we must remember that it's both a public health and a human rights issue. And it's very imperative that we need to remember that. But what we need to also remember that every year, more than 1,500 Ugandan women and adolescent girls die from preventable maternal causes. Yet for many that pass through this motherhood, it doesn't usually begin with choice, but with violence. Some are pregnant because they were coerced. I know in our culture, we kind of debate that nobody can force anybody to have sexual intercourse, but it happens. So that we need to remember that some of the women that we have in our labor, they came there because they were violated. They didn't want to get pregnant. So what we need to think about as healthcare providers, especially midwives, and also those in other sectors, that it's important that we need to strengthen the multisectoral collaboration and the mutual accountability that go beyond the health sector when we are dealing with pregnant women. So when a woman is safe, we need to remember that when a woman is safe, respected, and healthy, she gives birth not only to a child, but to hope. But in our setting, there are some women who experience safe motherhood after being violated. So the question you might ask yourself is, how can a woman experience safe motherhood when her autonomy, safety, and dignity are compromised long before she enters the maternity ward? For us who are on the receiving end, we're receiving somebody who we think she got pregnant when she was happy. But we need to ask ourselves, this question, there are some women who come there after they have been violated. So we want to talk about these issues today. And for some of us, maybe these concepts might be new, but to most of us, it might not be new. When you talk about GBV, it's not only those who are physically hurt. There are some who come there because they are emotionally hurt, and some even economically abused. You can imagine a woman coming to a labor ward with nothing for the baby. You might think that they are poor, but some, they come there with nothing for the baby, not because they are poor, they can't afford. Somebody, a husband, a partner, let them go to the labor ward without giving them anything. They'll say, go and figure it out. It's your issue. or they are too drunk, they want to use the money for alcohol, they can't provide for the family. That's economic abuse that the pregnant women, feels. When it comes to safe motherhood, for us, we want to make sure that every pregnancy is wanted, every birth is safe, and every woman survives. It becomes a challenge for women to survive and for women to have safe birth when they have been violated. And what we want to talk about, and I'm glad looking at the panel here, we have Commissioner Angela from the gender. I was telling you that, Commissioner Angela, you're coming here on the last day. We have been talking about these issues. We wanted to talk about the multisectoral approach to safe motherhood because we want our colleagues from gender to also be with us. Then we're looking at our colleagues. I don't know if there's anybody from the justice system here. There's nobody from the justice system because when it comes to safe motherhood, issues of GBV, our colleagues from gender justice system, they ought to be here. Local government sectors, education is here, so we are happy we have all these people who are here. Because what is important is that safe motherhood demands that the health system, the justice system, and the education system, the gender system, we move in a lockstep. When all these work together, the prevention, the protection, and empowerment of a woman really flows naturally, and you can really have a woman that delivers a baby who is happy, and also a mother who is happy, and they can also grow healthy. Moving forward, I just want to highlight the price of inaction when it comes to issues of GBV. Inaction is not just unjust, it is unaffordable. I want to highlight the numbers that we use. 56% of Ugandan women have faced physical or sexual violence. This is a lot. Most of them are not documented, unfortunately. And this is another issue that we need to think about. And because they are not documented, those of us in the labor who are at the receiving end of a pregnant woman, we never think that some of the women who came there are coming after being violated, or physically or otherwise. 25% of girls are pregnant before age 19. Yes, some of them might be consensual, but some of them, they have been coerced in the process. And this is the gender-based violence that we are talking about. 31 trillion Uganda shillings is lost annually due to GBV and its ripple effects. The ripple effects, you might have some women who go into postpartum depression. Depression requires medications. When you look at the stock status of the Ministry of Health, you see that medications, when it comes to, to manage mental health, they are not always there. And people have to go to the grocery to find them. Some, they stay at home without going to work. These are the effects that we are looking at. And we talk about 189 maternal deaths, women that die during childbirth. Our target, we talked about it the first day, our target is 70. Just to mention that some of these women die because they were violated. Can you imagine you want to go and deliver, somebody is telling you, there's no money, I have no money, yet he was drunk yesterday, and they were not able to provide for the women. As a result, the woman delays to go to the facility, she has no money to get transport. These are the women that we are losing, these are dying. It's very expensive. And their lost resources could build 1,000 maternity wards, train 2,000 midwives that we are looking for, and supply 10 million contraceptives. So we are just saying, because of the cost of inaction, we are losing so much money. And these are the issues that we want to look at it. And behind this, you can see that GBV is one of the causes. I just want to share that, this socio-ecological model that shows that everyone has a role to play when it comes to issues of GBV. GBV is not caused by gender-based violence, it's not caused by an individual alone. It's reinforced by institutions, by communities, by systems that tolerate inequality. I want to start with the individual. If we can't empower a woman, girls, giving them education, giving them the knowledge, giving them the economic empowerment, these women will be disempowered. That's why sometimes you find a 16-year-old getting pregnant. That's violence. This is a minor. And the cost of inaction is what we see in our communities. So GBV will be caused by those people who did not allow this individual to get the right education. You look at the whole issue of institutions. There are so many institutions. We have talked about the education sector. We are looking at the justice system. When they hear that a woman had problems, we didn't go there early. We end up contributing to this. We are looking at the budgets where we didn't put adequate resources to educate the girl child, to give the right information, even the right information to the health sector. These are the issues that contribute to this ecosystem that causes GBV. Then you're also looking at our society. There are so many things that we look at, which really we must make sure that as a system, as a household, as communities, we need to be able to talk about the issues that are happening around us. Sometimes we put a blind eye because it's not us who are causing it. So eliminating GBV, it really requires across layers of the social system, from empowering individuals to enforcing national accountability. If we can't do that, we'll see so many ripple effects that are happening in our community. Moving on, I want to look at the multisector collaboration that there is one vision, but with many systems. When you look at the health sector, for example, you look at the quality of care. As midwives, sometimes as doctors, we are not trained about issues of GBV, how to spot it, how to give, even to give for prevention, to give advice to pregnant women that because you're pregnant, you might face this. You train the health services that tell the young girl how to identify when they are in trouble. So within the health sector, one of the things that we want is to make sure that we integrate our services. GBV screening and survival centers must be there in our antenatal clinic, in postnatal clinic, and even in maternity wards. It's not only for those who are in maternity wards. Let's start it in antenatal care. Imagine somebody getting pregnant this year, 2025, 2026, 2027. It should be an alarm. Are you getting pregnant because you want to, or somebody is forcing you into the situation? Very important, and we need to look into this. We are looking at the whole issue of justice and governance system, accountability and law. We must enforce GBV and child marriage laws. We don't want 16-year-olds to get pregnant. Let's spread the message. We have had programs talking about it. It's very important that we continue about these issues. In our systems, the gender programs shouldn't just talk about it at central level. Are we talking about these issues at district level, at sub-regional level? Even in the PDM level, we have community health workers, VHTs. Do they have this knowledge? The education system, let's empower that girl child. Let's prevent girls, let's keep girls in school so that, we also strengthen sexuality education. I know it's a tricky issue to talk about sexuality education, but it's very important. Let's address school-related issues. Safe motherhood is not the work of the health sector alone. Everyone must come in the system, the justice, education, to make sure that we talk about these levels. If all these three levels are talking about it, the women can survive, the families will thrive, and communities will prosper. Collaboration is very important, and collaboration without accountability is charity, and collaboration collaboration is transformation. So let's be transformational in the process of addressing GBV, especially when it comes to safe motherhood. When all is said and done, we'll see that there's no single ministry that can end GBV. That's why we're talking about collaboration. Let's build on the national GBV policies, the strategies that are there, the path platform, so that we plan together, budget together, accountability. The NPD4 has already set the stage there, so that the social sector is talking together to make sure that we address all these issues. Your success is linked to her survival. Then how do we move from here if we want safe motherhood and we build on safe systems? Let's invest in prevention. Let's reframe safe motherhood as a national development goal, not a health target, and make sure we empower the frontline workers, the midwives, the VHTs, to make sure they are all champions in safe motherhood. I've seen the clergy here, which is very good. The community is here. Let's all talk about it so that when it talks about safe motherhood, we shouldn't just look at a woman should be pregnant and be healthy. Are they happy? Did they really want to get pregnant? And also, let's use data to drive budgets and accountabilities. Maybe the finance minister might be saying GBV is not important. Can we use data that will show them why we are spending so much on 16-year-olds with complications, so much with women who are get to be violated? Let's measure what matters and add GBV indicators in our maternal death dashboard. It will be very important, otherwise we'll lose it. Also ensure domestic financing to progress, to make sure that we make progress whenever we're reaching out to our partners. Finance it smartly. Domestic financing, let's not just wait for the donors. I know we have our donor here. The donors can give us, but just up to a certain point. As a country, let's make sure that it's there within our system. If we do that, we'll end up having every pregnancy which is wanted, every childbirth will be safe, and there will be no GBV. And at UNFPA, we talk about 3 zeros. We can do that if we all work together. And as I end, I want to just highlight a few areas where, as UNFPA, we have worked to make sure that we integrate GBV with SRHR, with safe motherhood. We are running in Busoga region a project on Together for SRH, where we have integrated SRH, GBV, and HIV services. The Ministry of Health is talking about integration. We don't want to go in silos, but go together so that you have a midwife that knows about HIV, that knows about family planning, youth, all those things. I know we are complaining our health service providers that we are being bombarded, but let's be intentional. Let's have all this knowledge so that when you are meeting somebody, all those aspects need to be included. I also know that we have a project in the same Busoga region on where we're empowering youth to prevent violence. And one thing that we have learned working with CARE is to put in a component of economic empowerment. Because the women who are not empowered, who are not economically empowered, it's really difficult to say no and to really take, to be empowered and to say no and to get the right services. And also the support on data system, it's very important. If you don't have data, you can't convince anybody what you're doing. And I'm just showing you what the Ministry of Youth, the Ministry of Gender, Ministry of Health, they have various documents that they are using, which are key national and sector documents that we must be aware of. What I'm talking about, it's there. There are guidelines, there are frameworks, they have been launched. We are supposed to be using them. If you're not using them as a frontline worker, please find out where you can have the health sector gender mainstreaming strategy, where the national gender policy is, where the integration framework is, where all these frameworks are. You need to have them. Demand for a one slide, which you can use for you to understand how you integrate the services. If we do this, we can have safe motherhood. We are going to have women who are healthy, with healthy pregnancy, healthy children, and we can have a healthy nation, because it's only these women who are healthy who can help in making Uganda a better place to live. Thank you very much. Oh, this is you.
Thank you so much, Juliana, really for setting the scene. And you made very interesting remarks about everybody having a role to play, and that's the socio-ecological model. You also looked at the cost of inaction, where when we fail to act, what actually happens. These are the deaths and the unwanted pregnancies that we see. We also talked about the missed opportunities that we should have had to intervene, and we are missing them everywhere in our system. And so we need to be able to respond and utilize those opportunities. Of course, collaboration and accountability, as well as investment, so that we can have every pregnancy wanted and every pregnancy healthy and with a better outcome. So thank you so much for setting that scene, and that is leading us into now the plenary session. I want to start with you, Madam Nekesa, to paint for us a picture. There's a 9-year-old girl happy in a primary school somewhere in Mbale, where you come from. What are those things that are likely to make her have an unsafe pregnancy when she grows up into womanhood? Could you paint for us that picture?
Thank you so much. Nekesa Harriet is my name, and I'm born and raised in Mbale district. When we talk of Mbale, for those who have been there, Mbale is so beautiful.
No, it's okay.
But there are also other unbeautiful things in Mbale. I don't want to hide my head in the sand and not talk about them, but I will talk about them to bring out the picture. But before I do that, I appreciate the organizers. I thank God that I'm here. Actually, I'm happy, I'm humbled that I'm in front of you and sitting here with my commissioner. I feel big, I feel excited, I feel humbled. I don't know how to explain it. I thank God for that, and I thank God for Heroes program that has held my hand and moved with me all along. Thank you so much. Mbale is characterized by its hilly. The terrain is hilly, in that even if they have made the roads, most of the times, the road, when it rains so heavily, you discover that the roads are blocked. Like a young girl has gone to school, or we have gone to the field, and when we are returning, you discover that the blocks or stones have rolled on the roads, and you cannot access the other side of the road. You have heard of floods, to mention but a few. Those are some of the natural challenges we have in Mbale. So I want you to imagine that picture for that girl at school. The challenges we have talked about add on those natural calamities in Mbale. I'll start by talking about my experience. Yes, the question says a girl at school, but I was once a girl at school and young in Mbale, in rural Mbale. I got married in the year 2006. I pray that my video may be played to show what I'm talking about and what it means to be abused or violated, so that we relate gender-based violence to safe motherhood. I request that my video may be played. I got married in 2006 at a very early age, and I was very excited because I had got Mr. Charming. I thought I had got it all. I had a job. I had just gotten a job. I had education. I had just graduated from Makerere University from Mbale, and now you've graduated from Makerere University. And here I was getting wedded to a young man at an early age. I was very excited. But the excitement did not take so long. It didn't take so long because I was abused during courtship, while in marriage, and because community, because our norms, because our culture had taught us or had taught me that when you get married, you stay there and you be strong. You stay there, you cling on. I had to wait. I had seen my mother. She's still married to my father. So I wanted to be like her and so many others. And who knows, at the back of my mind, I also thought it's normal. I was abused emotionally. Sometimes when we talk of the 50%, we think that it happens to the rural woman. I was educated. I was from a good family, and I was a CDO who had to advocate for other women. But here I was being abused. I was abused emotionally, called all sorts of names. Uh, I was not supposed to have friends because my husband by then, whichever girlfriend I would get, he would fall in love with that one. So I just hated myself and also hated the friends. I was alone. And actually, emotional pain was too painful compared to the other pains that I've experienced, because emotional pain, you go through it alone. Economically, my ATM was controlled by my husband. I thought back in my mind, I thought if I give him this ATM, maybe he will respect me or love me more. So I gave him my ATM, and he would control my money and make all the decisions in the home. I thought I would be a good wife, but instead I was labeled as the worst wife. Sexually, I was denied conjugal rights. Most of the times you tell me I've had it all with my friends. I have had it all with people who are better than you. And I was just there. No attachment, no what. He labeled me as you're too dry. You know, you're stressed. You don't have money. Your man has been controlled by another person. You're going through too much. And during sex, someone expects you to perform 100%. So I was labeled as a dry pan. Physically, that's what you're seeing. All forms of physical violence, I saw them. I experienced it. And not only alone when I talk of physical violence, also with my children. I have one of my children here. They know my story, and I talk about it freely. I have prepared them to hear it, because if I don't, I know they can hear it through social media. I have my daughter here, who one time was beaten with a belt. So the violence did not only happen to me, but also happened to our children, together with my children. I was beaten, pushed, kicked so many times, to the extent that I thought that I'd lost my uterus one time. I suffered from endless UTIs, UTI after UTI. I don't know, I suffered from UTIs. I thank God it ended at UTIs. I almost lost my mind while I was still in that marriage. How does this connect to what the moderator talked about? There is a very strong relationship between GBV, or domestic violence, that the one I'm talking about, and safe motherhood. One, if me, a mother, I'm tortured, if me, a mother, I'm going through the pain I'm always in tears, I'll not have time for my children. I'll definitely not pay attention to my children. No, it's not possible. It's not. Most of the times we become so rude to our children. Most of the times we deny our children so many things. The society around us isolates these children. I remember one time, one of my child was contesting for becoming a leader in school. And they told this child that, how can you become a leader when your father cut your mother? For you can't represent us. So some people's character is that selfish, and it affects us. And when it's affecting us, we are not going to advise our children on reproductive health. We are not going to advise our children on menstruation. We are not going to play our role as mothers. But what about the children who are seeing it, who are facing it? It pushes them out. These are push factors. Children go out, they look for love, because you're not providing them with an enabling environment. So a child will look for love elsewhere. And this child is so young and is looking for love elsewhere, will end up getting unwanted pregnancy. Remember, we are saying a woman should get a child at the right age and the right time, and when the person is ready to have that child. But because of domestic violence, the child can go and look for love elsewhere. The people around me, some of the issues we experienced as a family, they took care. Most of my family members were taking care of me, and at the result, our family income was so low, and moreover, I had to pay so much. Like you seen, all my bones were shattered. I have metals in my hands and even my bone. So it was so expensive, of which my mother, my father, my brother, my everybody was around me. I literally could not do anything for myself for 1 year, but I was hospitalized for 2 years in Kumi Hospital, Onino, and I appreciate Kumi Hospital and all the doctors who worked on me.
Sorry, I'll have to come in here because of the challenge of time.
Sorry?
I'll have to come in here because of the challenge of time. But we thank you for sharing your personal experience and really the role of inaction by the family. Maybe could you just in a minute just say what do you think should be done differently so that young girls are really well prepared, protected, so that they can have a safe motherhood? Just in a minute, please.
Okay. There are several interventions, but above all, the overall one is you need to do something. I need to do something. Let's stop the blame. Because when we look at living my experience, when you look at this primary child, there are so many perceptions, negative perceptions around this primary girl. So we need to do something. Do something. If you're a CDO, talk to the community, create community awareness. If you're in health, stop the rude language. Because most of the times our children, our girls complain that when we go there, they treat us harshly. They ask us questions which are not good. Why did you do it? When they are examining us, there is this question which they normally ask, what are you fearing? Why did the other thing entered you? Why do you fear my hand? So asking a child such questions makes this girl who is pregnant go away. So we need capacity building for the nurses, not only to do with skills, not only to do with the technical issues, but also these skills of attitude. We need to deal with people's character and attitude. We also need to empower the community, empower the women, empower the girls. I thank God that with Ministry of Gender, we have WEP, YLP, PW. There are grants that support women, but we need those specific grants for this girl who has gotten pregnant at an early age, so that the competition reduces. Because when you talk of WEP, any woman can qualify. But if we have a grant for only those girls who have gotten pregnant at an early age, then we can really support them and to also support their children.
Okay, thank you very much, Madam Nekesa, for sharing your personal story. It's a really very difficult one, but we're also grateful that you are here. And yes, let's applaud her for being very brave. So I'll now come to you, Mr. Semakula. Mr. Semakula, when girls grow up, they go to school, and as Minister of Education, you are responsible for shaping the knowledge, the attitudes, and behaviors of individuals as we grow into adulthood. So could you kindly tell us where do you see this missing? Because when we grow up and become adults, we become violent, we create unsafe motherhood. So what do you see that your ministry could do to really improve on this situation? Because this is the vehicle that we have that is supposed to change attitudes, behaviors, and indeed shape our culture as a people. Over to you, Mr. Semakula.
Thank you very much. Ladies and gentlemen, good afternoon. You all must have heard that the question was a mouthful. The answer must similarly be a mouthful. But before I get into the answers she has actually asked me to give, Just a brief mention of what I heard from the keynote speech. The keynote speaker mentioned that many times women go to the maternity ward and then they are castigated by the midwives and they are not treated well. The treatment is even more annoying and more sad when it comes to young people. We have had young people who have been in school and gotten pregnant and gotten to the level of going to the hospital, and the treatment they get there is so bad. But I just want to highlight one of the reasons why those girls must really be listened to properly. Many times, of course, they didn't like the rape. They didn't like the pregnancy. It is also possible that it came from rape. And of all rapists, the rapist could even be an uncle, or even a father, or even a boyfriend. Now, when you begin just castigating like that, accusing the girl of being in the wrong, you are actually causing more trouble to her. And this young girl may not have simply gotten pregnant, but should also have gotten an infection. Beyond the infection, she would have been pushed out of school. It is only until late that the Ministry of Education is coming up with a guideline of re-entry into school. But in the past, the unwritten norm has been that wherever the school identifies a pregnant girl, the penalty is going home. Yes, it may include home even these days, but she may go home with hope that she can come back sometime. But it is also true that when she became pregnant and she was forced out of school, she went into a very hostile community. You know how communities label these young mothers. They'll call them all sorts of names. They begin referring to their home as the home of spoiled children, the home of parents who don't care. They begin referring to the girl as the sinner, the evil one. We've even had religious leaders do the same, taking these girls that have gotten pregnant at some early level as actually outcasts. It is also true and very likely that even when this girl returned to school and the rest of the colleagues learned that she was pregnant, they also ridiculed her. They give them all sorts of names. You are not a Nalongo, but they call you a Nalongo just to annoy you. They call you Mama Prosi, all sorts of funny names they can. They call you an outlayer. They call you Jaja. Now, all these are challenges this girl could be going through, so it is not really good that when they come to the hospital now to get that service, they are again castigated. As an educationist, I also want to confirm from the speech of the keynote speaker that indeed education is very important when it comes to matters of safe motherhood. We know that these children, these girls are young today, but we keep calling them the leaders of tomorrow. They are not only going to be leaders, but they'll also be mothers of tomorrow. They'll also be fathers of tomorrow. So for us in education, we're interested in giving them the information that will make them good fathers and good mothers, although we have to give it to them in a dose that is appropriate. You will not find us teaching nursery kids about menstruation. You will not find us teaching P2 students about courtship. We only do it according to age appropriateness. The speaker was also keen to say that it is tricky to talk about sexuality education. Just to assure her that there's no problem, as long as you use the right name for it. The challenge we've had in the country here is that when we embrace this type of education, it came with a very powerful name that confused many people. Actually, at the Ministry of Education, we refused to accept the name comprehensive, and we simply moved on to accept sexuality education. Even then, we learned that there are people who are not friendly with that name. So we actually made efforts to begin reviewing the framework to rename, but also to think of the new content that should come in that package. So no worries, the ministry embraces any information that supports young people as far as their growth and development is concerned. We are actually reviewing the framework led by the Honorable Minister of Education and Mama. She is leading the review together with the Minister of Health, together with the Minister of Gender and their permanent secretaries, together with the Minister of Ethics, but also very closely related to the Interreligious Council. you realize that majority of our schools in this country are actually founded by the church or the Muslim leadership, and so for whatever we do, we consult them. And finally, coming from the presentation is the issue of, no, I think this one has come from my sister here. She was saying Mbale is a place of calamities, and indeed that made me remember that while the girls in Mbale may suffer from the landslides and others, even other young Ugandan girls are suffering from many other physical challenges where they are. We've had, for example, floods in Kasese. They led to closure of schools. Sometimes students were forced into a lockdown again, even beyond the COVID lockdown. Many of them were girls, and when they go home, you know what follows when they are not in school. So we've had girls in Kasese experience that. We've seen the Ebola experience, the Mpox and all that. So it is true that where there are calamities, children are affected, but the girls are even affected more because when they get home, there is normally trouble. As a ministry, we have embraced the idea of allowing teenage mothers to return to school. But that has also not been well received in some circles. There are people who think we have actually spoiled them, that we are going to spoil other girls as well. But for us, we believe that an educated woman actually leads to an educated community. We also believe that when a girl is not educated, you are pushing her direct into the cycle of poverty. Because then when she starts without a job, with a husband who has run away because he fears to be imprisoned, then which type of world are you sending her in? Now, very quickly to the question. I don't even remember the question, but at least I remember the answers that I prepared. Answer number one, as Minister of Education, we see the challenge of gender-based violence. What are we doing about it? We know that gender-based violence starts at many levels. And in many cases in Africa here, it even begins from the home. So we have left what to do in the home to the Ministry of Gender. And for us, we are more interested in what to do at school. So at school, we have put up senior women teachers, we have put up senior men teachers, we have put up counselors. We have tried to ensure that we retrain the teachers who still think in terms of caning and knocking the head and sending children to go for water, to the fact that there are alternatives to corporal punishment, which are even better ways of disciplining than using violence. When you talk to the child, when you call the parent, when you demote the child from being a prefect to becoming a commoner, when you deny them a simple privilege like going to play at break time, that could be good enough to put them back their senses than hitting their heads, than caning them, and so on and so forth. Working with UNICEF, we even came up with a full booklet that can guide these teachers on those possible alternatives. And we have also often cautioned the teachers. The violence you display to the children may also get back to you. I have personally seen children waking up to box the teacher to the complete shame of the teacher. You have been using the cane, the child gets exhausted. I hope you people know what happens when you chase a rat and it fails to get where to run to. What does it do? It jumps on you. So we've seen children who are really squeezed in violence getting back to the teacher. And at the end of the day, the teacher is ashamed. We have seen teachers beating children badly to the extent that they've called them mental health challenges. We have seen some teachers beating children whose destination they don't know. But at the end of the day, the child you tortured in school is now the ED of SEHAT. The child you tortured in school is now the CEO of MTN. You also want your children to get jobs and all that, and you can't get there. So we keep telling them about so many of these. But the other thing we are also doing as a ministry...
In 2 minutes, could you conclude in 2 minutes?
Okay. Okay, I'll wind it up for now by mentioning that we've developed quite a number of guidelines to support our teachers on handling violence against children in schools. We, I told you, are reviewing the framework, and part of the big content in the framework is actually concerning gender-based violence. We have come up with guidelines on re-entry, on reporting, tracking, and response to violence. We have guided teachers with so many messages on the talking compounds and so on and so forth. Let me just cut it at that for now. Otherwise, I can speak until the cows come home.
But thank you so much for really highlighting the positive direction that the Ministry of Education is taking. We are really excited about even the back to school policy. It was very, very helpful. Madam Nakafelo, Mr. Semakula from Ministry of Education said that the things that happen in the home, they have left it for the Ministry of Gender. So your ministry is at the center of really addressing and tackling gender inequalities in society. The youth, the men, women, families. So what is missing? You walk this through. What is missing? What can we bring on board and tackle this differently?
Thank you very much, Patrick. I would also like to thank the keynote speaker and the panelists for the areas that they've so far covered. Really, I would want to focus my discussion around 3 areas. First and foremost, we need to shift our value system. Yes, as a country, we have positive laws and policies. Henry has elaborated on so many programs that are being implemented in the right direction. However, we've not been able to shift our value system in harmony with our laws and policies. The laws are very clear in terms of promoting equality and empowerment of women and girls, but we still have social norms, negative social norms, values and practices that continue to discriminate against women and girls. My colleagues have already talked about many, but I would want to talk about child marriage. And this is one of the elephants in the room when we talk about safe motherhood. You find in our case, girls are subjected to defilement, even as early as 5 years. When it comes to puberty, definitely these girls find themselves pregnant at a very tender age, even when their reproductive system is not ready to carry another baby. And the cultural practices dictate that once a girl gets pregnant, then she definitely has to go for child marriage. So along that cycle, there's a lot of discrimination against these girls, to an extent that they're missing out on quite a number of enjoying their rights. Right to education is one of them. Right to protection. Instead of parents and communities protecting these girls, we hand them over to the person who defiled them for marriage. So they're not protected against the defilers or the violators of their rights. And of course, they find themselves drawn into a web of roles and responsibilities that they are not prepared for. So we really have to do quite a lot in terms of shifting all these value systems that continue to discriminate against women and girls. Female genital mutilation is a very good example where these girls are mutilated, and on mutilation, they're then forced into child marriage, and the cycle starts. There's still a lot of discrimination against women and girls, and once we don't promote equality and empowerment of women, even our laws and policies, we are not able to implement them. So first and foremost, ladies and gentlemen, we need to pay particular attention on ensuring that our value system, our practices, the social norms that we celebrate, embrace equality and empowerment of women. That also brings me to the issue of parenting. We have serious gaps in parenting. We find ourselves, our children are not getting the best in terms of their lives. There's quite a lot in terms of neglecting their roles and responsibilities, neglecting their fundamental human rights, and quite a lot along the way, they find themselves really very vulnerable to all forms of discrimination and violence. So we need to parent, we need to strengthen our families to be able to provide a very conducive environment for our children, our boys and girls, to be able to grow in a nurturing environment. Henry has already talked about the life skills. Sexuality is an area that demands quite a lot of attention. Young people have to learn to know what it takes to engage into sexual-related relationships. But also, as of age, you also need to learn to not to subject these young people to unnecessary sexual relationships. So sexuality education still remains a cornerstone for us in terms of ensuring that the girls especially are prepared to navigate the challenges they go through when they reach puberty, and of course when unavailable circumstances of defilement, they're subjected to all forms of violence. That also brings me to the next point of promoting positive masculinity. Uganda, like any other country, we like it or not, men and boys are still very powerful, still entitled, and with a lot of privileges. We are yearning for a situation where men and boys can reach an extent of utilizing the power they have to protect the girls and women. So we need to nurture boys into gentlemen such that we are able to see that power that men still have being utilized for a good cause. It does not entitle you to subject a girl to defilement even when you can. So we need to use that power to say no to defilement, to say no to other forms of violence, and of course ensuring that we utilize the resources at our disposal to promote women and girls' rights. That also brings me to women and girls' agency. The laws are very clear. No violence against women and girls. We also find ourselves as women that we accept some of these negative practices to continue. I would want to talk about female genital mutilation. In communities that are practicing female genital mutilation, it's basically the mothers, the senior women that are really brainwashing the girls to accept to undertake female genital mutilation. All the surgeons are women. So as women, we also need to be very deliberate, take advantage of the enabling laws and policies to push for our human rights. Because we are, by nature, we are equal human beings. Funding is the last one. We've been implementing programs on GBV prevention and response, but because funding is limited, we find ourselves, our scope in terms of the numbers of districts, in terms of the areas of focus are also very limited. So as a country, we need to invest into serious investments into GBV prevention and response across the life cycle. Thank you very much.
Yeah, thank you so much, Madam Nakafeo, for those very discrete areas that you shared on parenting, on life skills, positive masculinity. Very, very, very good points. Now, the manifestations of violence normally end up in the health system. You find a woman with complications, and she has been beaten, there are injuries, there is rape, and they'll come to the health system. Dr. Irene, could you tell us what exactly is missing that we should do to reduce the burden of gender-based violence on the health system, and what are your suggestions on how we can really bring in these interventions? Over to you.
Yes, thank you very much, the moderator. And I also want to add my voice to appreciate the keynote speaker. Like you rightly said, things happen in the schools, in the community, and they end up with the health system. Before I begin, I just want to say that we are all aware that the young girls who become pregnant, that is violation. The fistula that results is a complication. The mortalities from the young girls are high. And when we look at the data, especially around the young girls and women, we see Bugishu, Busoga, Toro are really burdened in terms of GBV, and specifically with our adolescents. But like it has all been said, no one single sector can do it alone. We are not short of frameworks, we're not short of policies, we are not short of laws. As the health sector, I'll categorize the shortfalls or the gaps that exist in terms of addressing gender-based violence and therefore affecting the safe motherhood. I'll categorize them into three. We have issues around capacity, procedure, and workforce. When it gets to capacity, there is inadequate training, and in here you'll find a health worker who is faced with this young girl, and probably there may not be a high index of suspicion. This young girl comes in with symptoms that may not point to gender-based violence. Unless the health worker is well equipped and they can probe further, that's when they can appreciate that probably the reason why this young girl or woman is seeking services is because of GBV. Secondly, in terms of capacity, even disclosing, we know that our health workers may not be well prepared to communicate the findings. I'll start with the procedures that are needed to undertake once they suspect that this child or girl or young woman has been violated. So in there, we're seeing capacity gaps in terms of training, how they handle these young women and girls, the issue of being judgmental. One of the speakers said, you might not know the circumstance under which this young girl or woman had been violated. When it comes to the procedure, there are a lot of procedural hurdles. Survivors come in because of the processes and the procedure that are spelled out. they are sent back to police to pick forms.
Programming with government. I think we see PDM coming, but there are so many missed opportunities for integrating very good work within PDM based on what all our partners have been doing on what works, what changes behavior, what kind of content have you been doing? So I think that's also something that we really need to think of, and especially now that external financing is going down, it's something that I would really interest our colleagues from the government to think about it. How do you harvest the good practices, harvesting what works? And I have to be honest, in this work, sometimes some of the things we do don't work. But we are so afraid to say this doesn't work. And sometimes, unfortunately, we've repeatedly done what doesn't work. We've wasted money in repeating to do what doesn't work. So I think being able to have that mechanism for rolling what works and not wasting time and money on what does not work is very important. This is really what I can share. Thank you.
Thank you, Judith, for that very excellent presentation. And you've given us another perspective of what we really need to be doing as a country, working together under different sectors, telling ourselves the truth that behavior change takes time, but also not wasting time and money on what does not work. Very good messages among the several that you've given us. Ladies and gentlemen, we are really just on the dot of time. And our intention had been that if you had come earlier and we started at 2, there would be enough time really to interact and discuss. So we've also seen some questions on Slido. For instance, I'm seeing a question here. Somebody's asking, what are NGOs doing to help address, I think, or support sexual abuse to girls? There are quite a number of models, and there are very many NGOs here. I would want to recognize together with us, of course, there's been a Sehat here, there's a Mifumi here, Amref, and several others. So I'd want to request that as we try to wind up and we have some networking time, you can also get to know what are some of these interventions. Please kindly scan that barcode. We may post some of the responses, those questions there, because we do not have sufficient time to actually take many questions and respond to them in the plenary. So I'd like to take this opportunity to request you to please clap for our presenters. And while this was going on, I took a few notes, and there are some points that perhaps we can get as take-homes, but we shall also provide a session report and try to follow up on some of the good information that we have received here. The first take-home point is that freedom from violence is a human right, and that should be our drive to really make sure that we fight gender-based violence for mothers, but also for the whole of society. 2, that we need to tackle a shift. We need to tackle these negative norms and values and really try to make sure we have a whole of society shift in our norms and values. That the norms and values we bear and we live by should be, it should relieve our society from violence. The third take-home message is that everybody here and outside has a role. At home, as an individual, as an institution, on the policies and the government. Each one of us has a role. The other is that we need to take the integrated approach to leverage existing resources, but also try to have a domestic investment in really fighting gender-based violence. The 6th area is that the response to gender-based violence is a package. It's not just one single small intervention that will really achieve the fight against gender-based violence. It's a combination of interventions which are evidence-based and data-driven. There is also a proposal that much as the way we deal with mass interventions, be it immunization, be it maybe responses to outbreaks, we really need to have a mass movement that addresses gender-based violence in this country. We also need to have results-based action so that we only invest in things that give us results. The ninth and second last is that the fight against gender-based violence needs to be a long-term national development-oriented intervention. We cannot just do piecemeal things. So the ministries that are here need to work together because you are the ones who are driving the interventions of the country, including linking gender-based violence interventions to the national development agenda. And I think the last one I got is that let's not waste time on things that do not work. Let's be bold and tell ourselves that such and such an intervention doesn't work, and we leave it. So I want to really thank our panelists, and really please clap for them again. And also, I would like to recognize all our partners who supported us, first from AMREF to CODAID to MIFUMI to SEHAD, UNFPA, and the Netherlands Embassy in Uganda, and others, and all of you. We know you are our partners in this response, and so we recognize all of you for that. So I want to ask the panelists that this is the end. We stand there for a group photo, and then we shall close this session. Thank you very much. We look forward to working with you in the different spaces where we shall meet as we address this matter. So may I invite Madame Juliana, I know you left us a bit, but please come back, and we shall take this group photo and close the session. I want to wish you a very nice close of the conference and also a good weekend as you take some rest from tomorrow. Thank you.
As I reflect on the journey of AMREF Health Africa's Heroes for Gender Transformative Action program, I am filled with pride and hope. Over the past 4 years, we have worked relentlessly to address sexual and reproductive health rights, SRHR, and sexual and gender-based violence, SGBV, in 9 high-burden districts across Uganda: Kalangala, Iganga, Namayingo, Bujiri, Budaka, Mbale, Mayuge, Kwen, and Bukwo. Back in 2019, the statistics were alarming. 1 in 4 girls aged 15 to 19 was either pregnant or had already given birth. Nearly 24% of girls were married before the age of 18. Access to SRHR services remained limited, leaving many young people vulnerable. Determined to make a difference, we launched a program guided by World Health Organization's best practices and health and human rights framework. Since then, we have reached over 500,000 young people with comprehensive sexuality education through structured curricula like Journeys Plus and Program Y. Beyond school, we have engaged over 10,000 out-of-school youth through community dialogues and medical outreaches. But education alone, not enough. Strengthening health has been at the core of work. In partnership with 65 health facilities, we have trained 1,500 health workers on basic emergency obstetric care, BMOC, customer care, and inclusivity. Additionally, over 500 community leaders have been equipped with leadership and accountability skills to champion SRHR and gender equality. A key in our approach has been results-based financing, RBF, an incentive-driven model that rewards health facilities for improving access to antenatal care, skilled birth attendance, and family planning. Through RBF, we have created youth-friendly health corners, procured essential neonatal equipment, fenced health facilities for security, and even provided incentives such as internet access for health workers. This approach has fostered a culture of accountability, ensuring sustainable improvements in service delivery. Another milestone has been digitalization of the supply chain. With an investment of 160 million Uganda shillings in ICT equipment, we have enhanced real-time reporting and stock management. This has significantly reduced drug stockouts and improved service efficiency, ensuring young people receive the care they need when they need it. The results speak for themselves. By 2023, teenage pregnancies had dropped to 22% from 25%, and child marriage had reduced by 15%. The uptake of SRHR services among young people increased by 13%. These numbers are more than statistics. They represent lives changed, futures reclaimed, and a generation empowered. As we look ahead, our commitment is unwavering. We believe that every young person deserves access to quality SRHR services and education. With the continued support of our partners, we will persist in our mission because the health, dignity, and future of young people in Uganda depend on it. Thank you. As I reflect on the journey of Amref Health Africa's Heroes for Gender Transformative Action program, I am filled with pride and hope. Over the past 4 years,
Hello. Thank you very much. Thank you, our entertainment team. Yes, ladies and gentlemen, the time has come for us to close down the 3 days of very powerful discussions that we've had. I'm going to invite the Commissioner, Reproductive Health, to step in for the Director General in taking over presiding over the closing ceremony. Thank you. The entertainment group, just have one additional round, please, as we mobilize other members from other groups to join us. Team Scientific, let's ensure that all our, please give us the vibe as we encourage our colleagues. Thank you, thank you, thank you, thank you, thank you. A big round of applause for our entertainers. Just like my colleague had just mentioned, every good thing comes to an end. And today, tonight, we are summing up our very, very well spent 3 days here. And as we always say, in Safe Motherhood, we don't waste time. We're expecting a few guests to join us, but we have a couple of them here. And without wasting a lot of time, allow me appreciate each one of you. And I hope there's no breakaway session still going on. Allow me appreciate each one of you for your contributions, for your participations in this very important conference, the 5th National Safe Motherhood Conference. Can we put our hands together and appreciate ourselves? Our closing program is going to run as follows. We are going to receive a report of the key insights and actionable recommendations of the 5th National Safe Motherhood Conference 2025, and that will be presented by Dr. John Paul Bagala, Associate Consultant, Obstetrics and Gynecology, and also the Acting Assistant Commissioner, Reproductive and Infant Health. Thereafter, I will invite a few people on the stage who will be making declarations on behalf of their different organizations. We shall have a declaration from the voices of the young people and adolescents arising out of their pre-conference activities. We shall have
and each of them will be very timely. We shall have a voice from the CSOs, civil society organizations, and that will also take us only 5 minutes. We shall have remarks from the World Bank, representative of the World Bank in Uganda. I can see Dr. Rogers is already here. We shall have remarks from our chair, deputy chair of the Health Service Commission. We shall have remarks from Your Excellency, the Ambassador of the Netherlands, and remarks from Your Excellency, the Ambassador of Iceland. So it will be a short activity and well-timed. So I now take the honor to invite the team that has worked tirelessly to put together all the recommendations, all the insights, all the new ideas that are coming through from the different breakaway sessions, from the plenary, to step over here and give us a summary of what has transpired in the last 3 days. Dr. John Paul Parker, over to you.
Thank you very much indeed, Commissioner. Ladies and gentlemen, we are very, very delighted to have had you with us for the past 3 days to synthesize and renew our commitment to improve the care for mothers, babies, children, the adolescents, and ensure that we avert preventable mortality for mothers and babies, and ensure that every mother has the opportunity to live as she brings life to this world, but also every baby to have an opportunity to live and thrive. For the past 3 days that we've had the discussions, we've gone through a number of focus areas, and in only 6 slides, we've synthesized critical issues that have come through the discussion. And these have been sieved from the parallel sessions, the plenary sessions that we've had, and the 5 parallel sessions that have happened. The report for the 5th National Safe Motherhood Conference, a comprehensive report, will be shared. But what I'm going to present to you, which is a synopsis of that report, guides on what we are going to put our focus on over the next 1 year before we reconvene in 2026. The key focus areas, we are looking at revolutionizing the health workforce, integrating and financing resilient health systems, empowering communities, and leveraging data and innovation for accountability. Under the focus area on revolutionizing the health workforce, we've agreed to emphasize and enforce site-based EMOC mentorships and cascade continuous low-dose, high-frequency and facility-based mentorships to ensure that we close the skill gaps that are existent among us frontline healthcare workers. This critical point came forward during the presentation of the MPDSR report, where it was emphasized that we are seeing a number of mothers losing life following performance of cesarean section. So we've agreed that it's very important for us to cascade the emergence of obstetric and newborn care mentorships. And that is inclusive of the specific skill set mentorships, for example, the essential training in operative obstetrics. Secondly, we've also agreed to scale the professionalized community health extension workers model nationally with clear terms, their packages, and to have them well facilitated. This came out very, very strongly in the plenary session, the high-level presentation that was made on the second day by the Commissioner for Health Promotion. We've also agreed to hire, recruit, and train the critical health workers, including doctors, neonatal nurses, anesthetists, and midwives. And I think over the course of the 3 days, the aspects of recruiting this critical cadre has come out very, very strongly across the various discussions that we've had. In the focus area of integrating and financing a resilient healthcare system, we've agreed to decentralize life-saving and low-cost technology. Over the course of the 3 days, we've been subjected to life-saving and low-cost technology, which we need to scale up, which we need to cascade across the various levels of care. We've also agreed to ring-fence domestic financing to address our local gaps. And this came out very, very strongly in the opening ceremony, but also in the course of discussion. We've appreciated the narrowing donor funding landscape, and we've agreed that we need to look internally more. Thirdly, we've also agreed to fast-track the National Health Insurance Scheme with a full maternal and newborn health package. I think all of us in this room agree that this is an issue that is far delayed, and we need to ensure that it's expedited. Under that focus area, we've also agreed to ensure consistent supply chain management and security of essential commodities and equipment. If you unpack that particular point, it's speaking to how do we ensure that a mother who presents at any facility, at any level of care, the critical commodities that are going to care for that mother and ensure that she's alive should be made available. Under the focus area on empowering communities, we've agreed that we need to launch a national culture campaign that will enable us to engage cultural and religious leaders to lead dialogues and shift harmful norms. We all appreciate and have appreciated over the 3 days that the aspect of cultural engagement speaks and is at the center of the multisectoral engagement, which has been the theme of the 3 days that we've been here. We've also agreed to have stakeholders renew their commitments to enhance moral, cultural, and ethical strength in the fight against maternal and newborn deaths. And we've also agreed to integrate services at the village level. We want to leverage the existing government mechanisms like the parish development model and ensure that we are riding along those and leave no mother behind. Within the focus area on leveraging data and innovation for accountability, we've agreed to make data reviews non-negotiable, to institutionalize routine maternal perinatal death surveillance and response across all facilities and level of care. I think we all agree that at national level, we've nailed that aspect. But we need now to see ourselves in the respective local maternity and neonatal systems, in the respective districts and lower facilities, that the MPDSR mechanism is quite strong. We've agreed to create public accountability dashboards where we have real-time sharing of key indicators to inform real-time interventions. If we have a facility, a CMOC facility, without blood transfusion services, we must be able to flag that particular facility and have that particular gap addressed. If a particular health center cannot perform cesarean sections, and yet it's supposed to perform cesarean sections, that must be flagged in real time. And the cause for that gap must be addressed at national level, way down to the lower level facilities. We've agreed to establish an innovation adoption pathway that creates, which is part of the national framework for piloting, validating, and scaling up successful innovations. Over the course of the 3 days, we've appreciated, and within the parallel sessions, the valuable innovations that have been presented. We don't want those to end at just being presented. We want to go further and have them translated into life-saving practices. And we've also agreed to strengthen academia and make academia and research institutions as part of the informative processes that inform both policy and practice. And I'm very happy that we have academic representatives in this room to ensure that we take that forward. Ladies and gentlemen, that has been a synopsis of the discussions that we've had over the course of the past 3 days, and the final report will be shared with you to ensure that we hold ourselves accountable when it comes to October 2026. I thank you very much indeed.
Another big round of applause for Dr. John Paul Bagala. I want to thank him for putting this together, and I know he has captured everything. As we move to the last part of this occasion, I want to invite, I want to begin by our very important group, the CSOs. I know we had a lot of trouble. Maybe before we go to that, I've been reminded, and I think it is very important, that we introduce the team that has been very, very engaged in putting this together, and that's the organizing team. Wherever you are, kindly step forward and we clap for you. You've been running up and down. I know you're still running up and down. As they step forward, please. Now, for now, you keep where you are. I will call you to have a photo moment, but let's clap for them. Let's clap for them. Thank you very much. You've done a commendable job. And I must say that every year, Safe Motherhood Conference gets better, and better. I'm trying to buy time. The Director General is on his way. But in the meantime, he has allowed us to proceed. And allow me at this time to invite the representative of the young people and the adolescents. As I earlier mentioned, that the young people had their conference on the 21st of October before the Safe Motherhood Conference, and which we termed as the pre-conference activity. The young people are a very critical component of Safe Motherhood, not only because they are potential mothers, but ours have also started reproductive life, and we are not very happy about it. We want to hear what they have to say. The young people constitute, as they come forward, the young people constitute 50.5%. Young people less than 18 years constitute 50.5% of our population. Join me in welcoming the Assistant Commissioner, Dr. Irene Mwenyango, to take their seat with a very pragmatic young person, and she'll be telling us who she is. Also, allow me at this time invite a representative of the civil society organizations. They were right here at the beginning. They made a statement made by their chair, Ramka. Civil society organizations are very critical for our service delivery because they provide for us the social accountability. They are the extra eye that looks at what we are delivering, where we are not doing well. They hold duty bearers accountable. They provide us that extra feedback on what we are supposed to do, and we also, in a way, hold them accountable. We have been working with them, and there's a special platform called the Ramka N and the Elderly. We had forgotten the elderly, but now we have them. The elderly, if you're above 65, we are planning for you. And the one representing them is probably also above 65. Dr. Lydia Mongerera, formerly director with Mama's Club, coordinator of the CSOs at HIPAC. She has spent more than 10 years at HIPAC. A member of the Ramka CSOs group, member of the WHO EMTCT Afro Regional Validation Exercise. Join me to welcome Dr. Lydia Mongerera. She's a very young adolescent. Also, in a special way, allow me invite the representative of the World Bank. The World Bank, put your hands together and we welcome Dr. Rogers Ayiku. The World Bank is a bank without a house. It's the only bank without a house, but they provide us money. Part of our journey for the last 5 years, we received funding support and technical support from the World Bank under the AMCHI project. Part of the institutionalization of the funding support to the health facilities was spearheaded by Dr. Rogers Ayiku. I want to credit him for that, and Dr. Rogers Mulindwa. Part of the improved infrastructure that we are launching in our districts was part of the AMCHIP and UCRE projects, and the Ministry of Health, Reproductive Health Department has a special place of the platform GFF, Global Financing Facility Country Platform, where the World Bank participates, and we are co-creating together how we can get to the last mile. How do we get to 100? How do we get 100 in coverage and 100 in quality of care? We want to appreciate you. I want also, in a special way, to invite our special guest this evening, the Deputy Head of Mission, Head of Cooperation, Embassy of the Kingdom of Netherlands, and this is none other than Bowen Jan Smeding. Thank you for being amidst us and joining us this evening at the official close. Join me in welcoming him on the stage. You're welcome. I hope I've pronounced the name very well. My apologies if there was an omission. I also want, in a special way, to invite the head of mission of the Embassy of Iceland. For fear of butchering this name, the name is Hugo. But I know she's my friend. We met in Namusindwa. Thank you very much, and you're welcome, Her Excellency, and we appreciate you for being here with us. She will announce the name. It's genuinely a difficult one. Lastly, I hope I've not left anyone there. lastly, allow me invite the representative of the religious group. Bishop, probably the only bishop we've had for the last 3 days. Bishop Amos Agaba, a champion of safe motherhood, a clergy, a very committed man. We want to appreciate you, want to thank you for the support, and request that you kindly join the podium as we make statements at the at the closure of the 5th National Safe Motherhood Conference. After these guests, we shall have a message from a representative of the minister that will be delivered by our Deputy Chair of the Health Service Commission. She does not need to be here, but she will come and give us a brief message after. I want to begin with the young people. We are eager to hear from you. And I'm not going to allow you to sit. I want everyone to see you. We are making you the leader of tomorrow. I know you want to say you are the leaders of today. But I'm happy to adjust this for you. We are all in support of you and eagerly waiting to listen from you. Thank you very much. And you are welcome, Madam Her Excellency, representing the 50.5 million Ugandans. And that is close to more than 22 million people. Step forward. You want to introduce her? Please come.
Yes, thank you very much, Commissioner, our distinguished guests, protocols observed. Good evening. Like introduced, I'm Irene Mwenyango, and I work as an Assistant Commissioner, Adolescent and School Health. I'll straight away let this congregation know that on the 21st of this month, we had the pre-youth conference under the theme, Strengthening Multisectoral Approaches to Improve Adolescent Health and Well-Being, an event that was graced by the Permanent Secretary, Ministry of Gender, Labor and Social Development, and we had a keynote address from the Executive Director of National Planning Authority. During this event, we were reminded that there is need for meaningful progress in adolescent health if we engage young people and adolescents meaningfully. At this point, allow me to thank all the stakeholders that supported us to ensure that the event happened successfully, and those that supported the young people to participate in the event. I would like to invite our young person who participated during this event to share the outcome statement or the communique that we agreed upon, representing all the adolescents from the various regions and districts. And this is none other than Gabada Lucy. She's a senior 3 student from Air Force Army Senior Secondary School, Entebbe. Please join me to welcome Lucy.
Good evening, everyone. It's such an honor for me to be here among all students, all adolescents. It's really such an honor. Thank you very much for having me here. Okay, my name is Gumba Dalwanzo Lucy, and I study from Air Force Army Secondary School. And I'm going to present to you a comic from adolescents and young people of Uganda. I'm going to add my voice to others So, on 21st of October 2025, we as young adolescents, we met here. We were from various districts. We met here to come and learn some new things and also share some of the problems which we face. And some of the problems which we face, we see about 1,000 girls get pregnant every single day. This is just not a number. It's a cycle of poverty, illiteracy, and poor health outcomes that needs to stop now. I say it now. Okay. And also, over 8,000 adolescents tested positive for HIV this year. This is unacceptable and unfortunate. And on top of this, we are fighting mental health issues, gender-based violence, and harmful cultural norms that limit our potential as young adolescents and young adults. We are just not problems to be fixed, ladies and gentlemen. That's why we attended a conference, we presented different poems, different skits as a testimony to you to prove that we are ready to be partners but not guests. Our wins and tools, we appreciate the progress that the government has made. The government has set up adolescent health committees in 62 districts. Teenage pregnancy surveillance and response system initiated and scaled it up to 31 high-burden districts, increased the number of districts with children reference groups. And also, this is the thing which I love most, the government made it easier for adolescent mothers to go back to school through providing guidelines for entry. And also linking schools to facilities, conducting community outreaches to improve access to services, availing toll-free lines and call centers to provide accurate, age-appropriate information. Ladies and gentlemen, really the government is doing something great. To top on that, also during that day, the ministry also launched 3 major documents that will further guide implementation for adolescent health. And the first thing is the National Adolescent Health Costed Implementation Plan, which is from 2025 to 2030, and the Teenage Pregnancy Surveillance and Response Framework, the Annual Adolescent Health Report. And also as young people, since the new curriculum emphasizes us to be creative, we also showcased some brilliant ideas. We had peer-led HIV prevention models, mobile apps for getting the right information, and projects that are making us get money as young people. And also the big lesson I learned. Do you want to listen? Peer support and teamwork works. For real, no man is an island, so we need each other's support, and I really like that. That was the biggest lesson. And also to dive in more on our commitments and non-negotiable demands, we had diverse stakeholders from police, cultural leaders, ministries, district head teachers, COAs, NGOs, name it. Then to the government, ministries, districts, partners, religious and cultural leaders, fight child marriage and gender-based violence. Don't just slate the laws, enforce the laws themselves, and expand youth-friendly services and put mental health, life skills, sexuality education into schools and communities, ensuring that all adolescents like me and young people across everywhere receive this access. And community leaders and religious leaders, please, I beg you, you must champion the fight against harmful practices like female genital mutilation with alternative rites of passage in Sabay and Karamoja. You should also promote open and honest family dialogues. And I'm going to talk like the commitment as young people we made. We commit to being the peer educators, as I'm doing, the community advocates, and the mental health champions in our communities. We promise to be responsible and constructively engaged with leaders, mobilize fellow peers for services and opportunities in our communities. And for us all here, we must work together and use data to scale up solutions. Our immediate goal is to stop 1,000 daily adolescent pregnancies and make sure all young people, including those with disabilities, get fair access to services. The future of Uganda's adolescents and young people depends on what you do right now. Let's stop talking. Yes, let's stop talking, start mobilizing the funds and start acting. Empower us, the adolescents and young people, to realize our full potential. So this is the end of my manifesto, but as a young person, I wanted to leave you my poem. I really love poetry so much. It's one of the tools which I use during the assemblies to educate my peers, because we are a population of 2,000 students. So I'm going to present to you my poem. When I whistle, when I speak, when I act, when I dance and swim to the rhythm of change, I rise. In my society, our society, there is this reality we strive in, a melody and tragedy that soars within, here and everywhere. With wings wide and can smile in the current tide, where dreams are left to bleed dry, where young seeds fed and cry, where madness thrives, FGM and GBV survive, clinging to young, innocent, tender souls, stranded and hard and thin, trapped in doom amid a society. My whistle begins. 10, 9, 8, 6, 7, 4, 5, 4, 3, 2. Let my whistle be your whistle, because there is power in a lion's roar. Tough enough to withstand the storms in our society, tough enough to withstand the bullets that trigger the young adolescent. There is light to guide the laws that echo in your silence. You are not just voices. You are remedies to bring healing to my broken society, our broken society. Together, let's fight for the adolescents, for their dreams still unspoken, for the hope that refuses to drown. Let us rule with courage in this cure. Smile with pride in every corner, for change begins when we choose to whisper. Now, whisper. Thank you.
Wow, 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 wow. Another big hand of applause for a young person. She has ably said they don't want to be guests, they are partners. I think you have heard the others. They don't want to be guests, they are partners. Message is clear, the poem is clear. Thank you so much. Wonderful. We have a lot of talent. So allow me make this brief correction. I had omitted the chair of the Health Development Partners. Kindly, Madame Lunguzi, representing UNFPA, step forward to occupy the seat for Health Development Partners. And a clap for her. She's very passionate. Can take this side. Your seat is over here. As the young person was submitting, we were joined by our Director General, Health Services, Dr. Charles Solaro. You're welcome, and thank you very much for being here again. We're also joined by the Under Secretary, Minister of Health, Mr. Kenneth Chiri. He's also here once again. He was here at the beginning. Also at the start, our PPH ambassador, Charlotte Kainerugaba, also joined us this evening. She's a very good supporter of midwives. And she told me that she had a gift for the best midwife in the country. So the best midwife at the award ceremony will get something from Charlotte. We now move to a representative of the civil society organization, another Dolson. Join me, put our hands together, and we welcome Dr. Lydia Mongerera. I had earlier given her brief. Dr. Mongerera, since for you, you are very few, so we shall reduce the time. Over to you.
Dr. Mugabe, thank you so much. And it's very difficult sometimes to talk after such an inspiring talk that this young girl has given, but she has given us the picture. I'm going to be talking on behalf of civil society. I know I wear many hats, but here I'm representing RAMNAC, which is our platform. We have a civil society platform. I also represent civil society because I am the founding director of Mama's Club, which I founded 25 years ago, grassroots mother networks, and that was done. But I also coordinate civil society on the Health Policy Advisory Committee of the Ministry of Health. I think I'm trying to summarize. To summarize it, I will say that we are really appreciative of the government and Ministry of Health for always involving us. We represent civil society on almost all the platforms in the Ministry of Health, and we are very grateful. We want to thank Dr. Mugahi and the Reproductive Health Department. I've been a member of the Maternal Health Cluster since I think I joined HIPAC many years ago. So we are engaged and we are involved. What we want to talk about, just a few points. Strengthening community systems. That's very important for us to strengthen community systems and also integrators be involved in the integration process which is taking place. We want to make sure our participation as civil society is at all levels. And that is very important for us. We want to also talk about financing. We want to make sure financial systems, which include what we've been waiting for, the National Health Insurance. We've been waiting for the National Health Insurance Scheme, which is not yet in place, but we want to make sure that all finance systems and civil society is engaged. And as I mentioned earlier, engagement and involvement means planning, programming, implementation, monitoring, and evaluation. We also want to talk about the commodities because they affect us. Our people are in the districts, and we want to make sure there's a smooth flow of commodities. Talking about HR, the issue of midwives. For us, we know very well with the safe motherhood, the reproductive health, we need the midwives. The midwives are the most important people to us. They are the core of safe motherhood. At the same time, we welcome the community health extension workers. We know that community health extension workers from long ago, I was actually met them many years ago in Addis Ababa, many years ago when Ethiopia had started that system. But besides that, we want to be sure that there are other community structures on the ground. We know very well that CHOOS will work with the mother mentors, they work with the YAPs, and other people who are on the ground who are already existing, who are there, including the VHTs. We want to talk about accountability systems. We want to talk about mutual accountability. When we talk about accountability, it must be mutual. And of course, we've got tools also which we are involved in, the community-led monitoring system, which we started and is still in place. where we go and monitor in the communities how the quality of services, and we have that feedback mechanism. So we want the government to recognize that. We also want to talk about other programs which we know, of course, including the involvement. I was so happy to hear that people are talking about male involvement, because we know now that we need to involve men, we need to involve the fathers, and that's true. We want to talk about our commitment, and we want to commit ourselves to this partnership between civil society and the government and the Ministry of Health. We've been involved, but we want to recommit and mobilize our communities for safe motherhood. Safe motherhood is very dear to all of us, and we want to recommit ourselves. But remember, as we recommit, there must be resources, and we continue to call for domestic financing, because we know very well we cannot continue relying on external donors. So this is what we are saying as society. I was given 3 minutes only. Of course, Dr. Mugahi, you cheated my time, but I will accept it. Thank you so much. And thank you so much that there's a number of civil society organizations who are here. And thank you for always involving us in the Safe Motherhood Conference. We promise that we shall always be here. But of course, I really wanted to close by recognizing my civil society members. Jackie has been steering us. Jackie,
another big round of applause for Dr. Lydia. Thank you very much, Lydia, for representing the CSOs and the great work that you do along with Jackie. We really appreciate you. Keep us in check. There's nothing you can do without being checked, so we really appreciate that. DG, well, you're aware, and when you're on your way here, I assumed your shoes. I'm trying to fit in, but I'm requesting that you leave me in Entebbe Uwoma for a few minutes. This was supposed to be chaired by yourself, and I'm moving on well. I want now to invite the only bishop who has been here amidst us. He prayed for us. He has been meditating for us. Every night he meditates for the mothers, even the fathers. Safe motherhood is not about mothers alone, also the fathers. So hopefully next year we shall talk about survival of, yes. Your Excellency, you're most welcome. This has been a very special conference. As Her Excellency takes her seat, I think you can see the number of our bilateral friends who have been able to attend this conference. It shows you the importance of this very engagement. I now take the honor of inviting Bishop Amos Magezi to make commitments on behalf of the religious fraternity.
Good evening, everyone. Amos Magezi is my name. It's true I am serving as the incumbent Bishop of the Diocese of Northwestern Kole in Ivanda, but I'm here to represent Faith for Family Health Initiative, where I am also serving as a board member, and I chair programs and policy. And I'm a champion of family planning. And I would like to mention two things here. Some people misquote the scripture, and they say, well, there's no need for family planning because God said, multiply and fill the earth. But let me be honest with you, that is very true because the word of God is truth, but it's not only one couple that will multiply and fill the earth. And so we need to understand the interpretation of the scripture when it is saying multiply and fill the earth. But also on family planning, I am encouraging men. There is a tendency of men running away from family planning and they leave it for women. But guess what? When a woman gets pregnant, we'll wait for 9 months to produce only one child. But what will happen if a man keeps going around to many women? How many children will be born in 9 months? I mean, how many women will be pregnant in 9 months? Now, that's the scientific you need science to interpret that. But you also can understand as a layman like me to understand that there is a need for men to go for family planning. I'm glad to be here in this conference, National Safe Motherhood Conference. And I would like to appreciate the Minister of Health for organizing this under the theme, Strengthening Multisectoral Collaboration and Mutual Accountability for Safe Motherhood. When we were discussing, since the time we started, I remember on day one, they were saying, what can we fix as one thing, and then everything will be okay. To me, I kept quiet because you don't need to fix only one thing, and then everything will be okay. Let me give an example. If you have a car and you fix the tires, but the engine is not working, what will happen to that car? Where will it go? What happens if you fix the engine, only the engine, and there are no tires? What will happen to that car? Where will it go? So I think the wisdom is in the theme itself, strengthening multisectoral collaboration. It means that everyone is needed. Everyone needs to do what he's supposed to do, what she's supposed to do, in order that everything will come in place. So I must say thank you to the Minister of Health and all the partners for organizing this and for bringing this to our attention, because this is exactly what we need at this time. So as religious leaders, we are committed to this. When we are talking about doctrines, we'll be separated because Muslims have what they subscribe to, Catholics have something what they subscribe to. And so, depending on everyone's faith, you will have what you will go and subscribe to as far as your doctrine is concerned. But when it comes to socio-economic and community engagement issues, everyone must come on board. And so I'm glad that I've been able to be part of this. And as Faith for Family Health Initiative, we have been in this for the last 5 years. I would like to mention that for the last 5 years, religious leaders have organized pre-safe motherhood conference to commit and account. And last year, under auspices of Faith for Family Health Initiative, we launched an interfaith alliance as platform to continue engaging on safe motherhood. Now, today, one of the commitments that have been mentioned, for example, under the key actions, there was one which says launch a national culture campaign, engage culture and religious leaders to lead dialogues and shift harmful norms. I must be honest with you, if you bring us together, we are ready and committed to take the message, because we have the platform, we have the pulpits, we have the groups of women or groups of men, groups of youth. And speaking of the youth, I was able to spearhead the task of forming the legal framework of adolescents' health in Ibanda district. And so just know that we just need the information. We are ready to go, but you need to involve us and give us the information, and we'll be ready to go with it and for it. I would like to once again pledge our commitment to go and serve the communities because they need our service, and the only time we can do it is now, because leadership is for a reason and for a season. God bless you.
Thank you, Bishop. And indeed, safe motherhood is in the hands of God now. Seek first the kingdom of heaven, and all the rest will fall in line. We really want to appreciate the continued collaboration with the faith-based organizations, and they have a special platform for Ramka. They discuss how to translate messages, like the message he has mentioned, of it's not biblically correct that you give birth to any number of children. Healthy child spacing is godly. Looking after the children adequately is also godly. And I think we need to engage you more, and that is our pledge. Amidst us, as we also received the Her Excellency, the Ambassador of Sweden. Your Excellency, you're most welcome. She will be presiding over the next session, which is the awards. She's the chief guest at the awards. So, Your Excellency, thank you for honoring us and arriving on time. Chief guest, we also amidst us have a special group of people that I wanted to recognize. In the multisectoral spirit, we also have people from Ministry of Education. Ministry of Education represented by Mr. Semakula. Just clap for him because we just want to appreciate the multisectoral engagement, and they've been here. We also have amidst us a group of committed people called the coordinators of the NASMEC subcommittees. PPH, Dr. Samo Nonge, Professor Nachimuli, kindly stand up for recognition. If you are coordinator of a NASMEC, NASMEC is National Safe Motherhood Experts Subcommittee, we stand up and recognize you. We really want to appreciate you. Thank you very much. Thank you very much. In a special way, we don't want to forget our funders. Anyone who contributed, including energy and your mental power, please, we want to appreciate them and clap for them. We want to appreciate all the other UN agencies, WHO and UNICEF, because UNFPA is representing them here. Let's clap for WHO and UNICEF. Now, allow me at this point to invite the representative of the Health Development Partners. They plan with us, they provide us technical assistance, they give us resources, they tell us where resources are to deliver these packages. It's now my honor to invite Madame Juliana Lunguzi, representing the Chair of the Health Development Partners. You're welcome, Juliana.
Thank you very much, Dr. Mukai. I'm sitting here representing the Health Donor Group. UNFPA is chairing, but I need to recognize our co-chair, Sweden, and also co-chair WHO, all the other development partners, the DG and your team at the Ministry of Health, including the Minister AI, and also recognize all the other partners who are here, our doctors, our midwives, our health workers, all protocols observed. We, the Health Donor Development Partners, want to really reaffirm our shared commitment to work with the government of Uganda and all stakeholders to ensure that no woman dies while giving birth. There's nothing pretty, as our clergy said, you stay 9 months hoping to go to labor ward to deliver a live birth. And not only do you see a baby dying, but including the mother. we want to commit that we want to see this coming to an end. Safe motherhood is not the responsibility of the health sector alone. We have seen this in this conference. It requires collaboration across education, finance, local government, justice, and community systems. So we are happy that our colleagues from education and other sectors are here, and also to give a big hand to our young girl. We can see hope in that girl. We therefore pledge to strengthen multisectoral coordination, align our investments behind one national plan, one budget, and one accountability framework. The ministry has stressed this, and as Healthy Moment partners, will align to this. And we also want to promote transparency at every level, from national systems to the last mile. We do not want to leave anybody behind. And together, we will champion mutual accountability, invest in innovation, and support Uganda's leadership in building a future where every pregnancy is wanted, every childbirth is safe, and every woman's potential is fulfilled. If you want to make a good Uganda, it starts with the woman. And that woman in the labor ward, we want her to be happy. If they are happy, the families will be happy. I thank you very much.
Thank you, Juliana. The people of Mane don't talk a lot. Now, DG, I'm going to request you, we have started the group of donors. DG, my supervisor, I'm going to humbly request that you step forward. I'll give you the protocols, and we are going to begin with World Bank, and then we follow with the Ambassador of Iceland, and then the chief guest for this closing ceremony is the Ambassador of the Netherlands. Our DG had more than 10 functions this evening. You know, he's a passionate Rotarian. He's a chief guest another place, but he's able to come here at the Safe Motherhood Conference. I felt if he allows me to continue, but he should make some comments, and then we proceed. Thank you, DG.
Thank you, Dr. Richard. I have allowed you to continue. Our guest of honor, all our partners, I think let me stand already on the existing protocol because, so first, my apologies for joining in late. And I imagine that if you are coming for the hour dinner, is this the dress code? There was no dress code which was given. But specifically, this afternoon, I have to join another group where today we commemorate the World Polio Day. So it gives me a pleasure to stand here. I think we have spoken about safe motherhood, but polio and safe motherhood are related because they provide a very comprehensive program for both women and newborn survival. So I want to take this opportunity. I am, apart from being the DG, I'm also a member of the Rotary Fraternity and the immediate past president of my club, RC Sunday. So allow me, in the spirit of integration, to share with you a word or two on this polio day as commemorate the safe motherhood. So today we join the rest of the world to commemorate the World Polio Day under the theme of End Polio, every child, every vaccine, everywhere. So as we come to the close of the fifth National Safe Motherhood Conference, Awards and Expo, there has been a global progress towards eradicating polio, a disease which has crippled millions, but now at the brink of extinction. The WHO estimates that vaccines prevent 2 to 3 million deaths every year, and vaccination remains one of the most cost-effective public health interventions. We use this day to reaffirm our collective resolve to reach every child, to counter misinformation, but also maintain high coverage. A polio-free Uganda and the world are within our reach. With unity, vigilance, sustained investment, we shall achieve it. I want to end by thanking all of you for all these contributions which you have made and your participation. I know it's late, and being here up to now is really a sign that of your commitment. Step motherhood is for all of us, as you have heard, and all of us are part of the compact of safe motherhood. I want now to hand over to Dr. Richard Mugai to continue with the moderation. And please accord him all the support you would have given to me. Thank you very much.
Thank you, DG. A big round of applause. And for his commitment, really, and we appreciate that, because polio is also another area that we need to address. DG, we shall complete the rest. Thank you very much, DG, but we are also privileged that the Under-Secretary representing the Permanent Secretary is still here with us, and Ministry is fully represented with the other commissioners. Nursing is here, Commissioners Nursing, Assistant Commissioner AIDS Control Program, and all the other dignitaries are still here with us from Ministry of Health. Allow me, I've been allowed to invite the funders. Now allow me to invite my friend. I had earlier talked about him. The only thing that I strongly remember about Rogers is whoever is getting RBF at the health center for, the man behind it. He fought battles to institutionalize RBF in the mainstream government funding. Dr. Rogers Ayiko, representing the World Bank, then step forward and give your remarks.
Yeah, thank you very much, my brother Mugahi. Habari za jioni. Habari za jioni tena. Okay, good evening. Yeah, thank you very much. Rogers Ayiko is my name. I work with the World Bank as a senior health specialist. I'm not the country manager, just for avoidance of doubt. So I'm here stepping in for the country manager who would have wanted to be here, but she's still traveling from DC, where she was attending the annual meetings. The chief guest, Your Excellency, is present, the leadership of the Ministry of Health, and all the senior government officials, development partners, ladies and gentlemen. I think before I read a few of the comments that the country manager said I should convey here, I want to also say that we belong to the Health Development Partners Group. So what the chairperson relayed, we align with it fully. So it is a privilege and honor to address you as we conclude this conference. In terms of reflections of what we've picked from this meeting, we have had powerful stories, including from our daughter, who was just here, a lot of innovations and insightful discussions. The urgent need for coordinated, integrated, client-centered solutions for safe motherhood has emerged as a central theme of this conference. Clearly, we recognize that Uganda has made remarkable advances in maternal and child health, but we have very big pressures, which we typically don't see from the health sector. The issue of demographics, the issue of macro-fiscal pressures, and the issues of epidemiological trends that are shifting. And very significantly, the evolving health financing landscape, where potentially we could have lost about 25 to 35% of total health expenditure. So all the solutions that Bagala was reading here, we will have to implement them with about 35% less resources. I think that should be at the end of our mind. And then, of course, what that points to is that prioritization becomes like our number one word in everything we do. planning, programming, policy, and everything. We must therefore act decisively, not only on the sector-specific recommendations, but also broader determinants of health, because that is where about 80% of the health problems come. Only through strengthened multisectoral collaboration and shared sense of accountability can we realize real change. On behalf of the World Bank, once again, and also the Global Financing Facility, represented by Grace seated down there and Scott, we want to express our sincere appreciation to all that have really moved this agenda of safe motherhood, and especially the frontline health workers who are taking thousands or hundreds of decisions every day to make our mothers get the best outcomes of healthcare. The World Bank and the GFF remain steadfast in its support of Uganda's development agenda. We look forward, maybe this is the form of commitment, we look forward to deepening our collaboration with the government and partners to achieve universal health coverage. And this is clearly because the World Bank president has committed to support at least 1.5 billion people across the world to access quality health services between now and 2030. And this almost translates to about 13 to 15 million for Uganda. So finally, may this conference serve as a springboard for robust and sustained action. May we leave not only inspired, but mobilized to do more, to do better, and to work together. I thank you.
So, today I learned a new word, that the clapping can also be anemic. Now the clapping we are doing is hypoglycemic. It's not only anemic, but hypoglycemic. And when you combine anemia and hypoglycemia, we are in trouble. So for a donor, we need to clap hyperglycemically. So we are working on so much with the World Bank. We are cooking with Rogers and the team and Dr. Murindwa, and hope very soon we shall be serving you. Thank you, Dr. Rogers, for your tremendous support to the survival of mothers and the babies in Uganda. Before I invite another friend of mine, I have been revising the name and I'm going to try it this time. I want to recognize two of our safe motherhood champions amidst us here. They've been very instrumental and they've recently retired, but they've really done a lot of work for this country. And one of them is Dr. Olive Sentumbwe, the most senior docent. Yes, we love you, Olive. You've done a great job. The other one is Maria. Olive worked for WHO, and she's now retired, but not tired, and we still won't need her. Maria, UNFPA. Maria. Yes, thank you, Maria. A very senior and seasoned midwife, worked with UNFPA. She's part of the reason we started Safe Motherhood and all the combing of the villages, hard-to-reach areas. And we really appreciate you, and I think we shall appreciate you people more. It's now my time to invite someone I met in Namayingo. Namayingo, Your Excellency, the team from Namayingo was here. The head of mission of the Embassy of Iceland, she's very passionate about maternal and reproductive health. The government of Iceland has been supporting Uganda through UNFPA on the fistula control and repair mission. I don't have the numbers offhand of how many women the money from your taxpayers has been able to give back dignity. Colleagues, you know what it means when a woman moves around with a fistula. I was in Namayingo to see the number of women giving testimonies who had fistulas corrected by our surgeons with the support from the people of Iceland. We want to appreciate you and ask you that we want more to prevent them now. We want more resources to prevent them. I'll be reaching out to you and we discuss the prevention strategy, but we really appreciate the resources that you gave us to repair the fistulas, and it's my humble honor to invite Her Excellency, the head of mission, Hildegard, to come and address us. I have tried.
Did I try? Good evening. That was very good. You got my name very well. Undersecretary, commissioners, religious leaders, development partners, ladies and gentlemen, good evening. My name, to make your life easier, my name is Hilda. I'm the head of mission at the Embassy of Iceland. I'm sure you're all exhausted after 3 days of deliberations, so I promise to be as brief as I can. But allow me to congratulate the Ministry of Health and the organizers for bringing together such an impressive and diverse array of participants. The conference is indeed a reminder that safe motherhood is not a privilege, but a right for every woman. It is the very cornerstone of public health, gender equality, and sustainable development. And I'm sure that during these 3 days, we have all learned, reflected, and networked, and celebrated the progress achieved so far. Maternal health indicators have improved remarkably over the past few decades, thanks to the tireless efforts of healthcare workers, policymakers, and community champions. Indeed, clap, because many of you are in this room, so clap for yourselves, please. Yet we really must acknowledge the persistent challenges that remain: adolescent pregnancies, obstetric complications, gender-based violence, and limited access to reproductive health services. Now, I am confident that the government and all stakeholders will continue to explore innovative solutions to address these challenges, and I'm sure that they have been discussed thoroughly for the past 3 days. Now, Iceland is proud to stand with Uganda in this journey. And as a humble, small partner, please indulge me a bit, but through our partnerships with district local government and development partners, Iceland has so far, as Dr. mentioned, supported the UNFPA STOP program in Namaingo district, addressing obstetric fistula and empowering survivors through treatment, rehabilitation, and reintegration. A key component of this program, in addition to restoring dignity, is to contribute to safe motherhood by equipping health facilities and strengthening the skills of health workers to make pregnancies and deliveries as safe as possible. Now, through our partnership with UNICEF Uganda, Iceland has supported improvements in water and sanitation facilities at health centers in refugee hosting districts in West Nile. Similar interventions have also been implemented in health centers serving fishing communities in Iceland's partner districts along Lake Victoria, further contributing to safe motherhood. Iceland has also partnered with UNICEF to support adolescent mothers and their children in Chiagegwa and Kikube districts, expanding their access to education and skilling, childcare, and protection services. And we have collaborated with IPAS in Tororo district to expand access to reproductive health services and address the root causes of maternal mortality and gender-based violence. Please bear with me, I'm at my last point in my overview, but we are also proud to be part of the ambitious Heroes for Gender Transformative Action Program, led by the Embassy of the Netherlands, and we're very pleased and proud to be able to participate in that program. And Iceland's contribution enhances SRHR, GBV prevention, and WASH services for vulnerable communities in Kalangala district, implemented by a consortium led by Amref Health Africa. And good to see Patrick here. Nice to see you. These contributions reflect the government of Iceland's deep commitment to equity, dignity, and the empowerment of women and girls. And we are truly grateful for all the partnerships. Now, as we near the close of the 5th National Safe Motherhood Conference, let us not lose momentum. I'm echoing what has already been said, but good messages need to be reinforced, and that is to strengthen partnerships across sectors and communities,
invest in health systems that prioritize maternal, newborn, and adolescent health, amplify the voices of women, especially those in underserved regions of Uganda, and most importantly, hold each other accountable to the commitments that we have made over the last 3 days. As I thank you for your active participation, your shared insights, and your commitment towards ensuring that every woman gives birth safely and with dignity, I wish I could end with a poem like Lucy, but I'm just not that talented. So allow me to end with your core message from this important conference, and that is, we have the solutions, now it's time to implement them. I thank you all.
Thank you, Your Excellency. Juliana has offered to teach you a poem. But those of us who remember football, I joked with Her Excellency while in Namayingo that I only knew about Iceland when Iceland defeated England. A country with 40,000, Iceland is 400,000 people approximately, but beat England of 50 million people in football, World Cup. So they are a very determined population, and I really want to appreciate it. I think I told you that. So thank you, Your Excellency, for those wonderful remarks and for being a very good partner to the Ministry of Health and the government of Uganda. I want to invite the chief guest, but I can't manage to invite. I want to invite the chair of the Health Service Commission, Madam Christine Kakuru, to step forward, make a few remarks, and invite for us the chief guest. The name I will give it to you. Can you put our hands together and welcome? Christine is one of us, as she'll be explaining to us, passionate about safe motherhood, a mother herself. Today, I got to know that she's also a Nalongo. We have more Nalongos in the house. Yes, there's another Nalongo here. Thank you so much. Your Excellency, I didn't know you know the word Nalongo. Oh, wonderful.
Praise God. Good evening, everyone. I want to take this opportunity to first thank God Almighty, who has enabled us to go through these wonderful 3 productive days here. I kindly request you to join our hands and thank God. My name is Christine Kakuru, the Deputy Chairperson of the Health Service Commission. I'm here to represent the Chairperson of the Health Service Commission, none other than Dr. Henry Mwebesa. I'm glad that yesterday, but one, he was here to officiate and open officially the 5th National Safe Motherhood Conference. We want to thank him and recognize him in absentia, but well represented. Can we thank the chair? Allow me, before I proceed, recognize the Health Service Commission members who have managed to persevere to this time. Kindly stand up for recognition. When we started, we were all 7 members, including our chair, but today we have been blessed to have Dr. Nambiru to be with us and Madam Akum Janet Apai to be with us. The rest wouldn't manage to turn up. But today, at least we have managed to be here since morning up here. Why are we here? Because when we started and when we were discussing, among other pertinent bottlenecks contributing or as cornerstone of causing all these problems hindering safe motherhood was human resource. And when we talk about human resource, That is a very important but critical resource to manage in order to, facilitate or enhance the whole system of health. Allow me first to maybe highlight what it means and what it takes. When we talk about the health system, we need three things fundamentally. We need the inputs. Among the inputs, we have the human resource. And it is the very, very cornerstone of the health system. Without a human resource, the system can't stand. Mention it can be finance, infrastructure, ABCD, but the human resource is the cornerstone of health system. Then we can talk of the processes which we go through in our systems as clinical or healthcare systems. Then at the end of the day, we want to depend and lean on you, human resource, that we have the best desired output or outcomes as the satisfaction of our customers, that is the patient. Allow me, before I proceed, I also express my heartfelt appreciation to the organizing committee, Ministry of Health entire, but the team which has spearheaded this. Kindly let's add on our hand clap to thank you so much. Imagine how we came from day one up to today. What we are deliberating on is very crucial as far as the safe motherhood is concerned. My appreciation also goes to not discriminating, but respecting all health care providers, from the directors in your respective capacities up to the last, I can call him maybe the support staff, because those are the food soldiers on grassroots who are helping us to have the other beautiful results which we had here yesterday, the other day, and today, where we have improved greatly in all performance indicators almost. Irrespective of the challenges that we came across, but for me, I have a belief that once we identify those challenges that we got as bottlenecks, we can turn them into opportunities for improvement. When you are performing, you can't fail or run away from challenges, but we can turn those challenges into opportunities for improvement. Yes, they are there. Every accounting officer, you are responsible to handle or look around. The DHOs present here, the ADHOs, the doctors, the nurses in your respective capacities, I want to thank you because your being here in this room underscores our shared commitment as the recruiting agent on behalf of the government. We feel empowered when we see you here. We want to thank God for you. As the theme reads, strengthening multisectoral collaboration and mutual accountability for safe motherhood, it is not just a theme, but it is a call for action. And all of us, as we are here there, me, I believe, and I'm contented that from here we are going to walk the talk. And by next year, we pledge together as a combined efforts that we shall have more improved performance indicators, God willing. It resonates deeply with core mandate of our Health Service Commission. We have our mandates. Allow me put it clear so that when you see us here, you know where we end and where we stop. Health Service Commission, in its special mandate or capacity, as established by Constitution of the Republic of Uganda, our mandate clearly is just to appoint persons in different offices from the lower up to the top, according to our jurisdiction. And we also, after appointing you, we go through a long process of recruitment. after recruitment, we assign people, or we recommend different officers to be appointed at different levels. We recommend to the president for higher offices and others to the Ministry of Health to take also its mandate. We have to confirm people in service in those offices. We have the mandate to promote those people who are supposed to be promoted. We confirm and approve people who are going for study leave. We have a mandate to review the standing orders for the health workers. We have quarterly performance support supervision, where we have moved, at least most of the facilities you have seen us moving around, not only to recruit, but also to check and appreciate you. When we come to your facilities, we are not only coming to check the system, but coming to appreciate the work you are contributing to the entire country. We want to thank you and thank you. When you see us coming to you, our first aim is to appreciate you because you are there and you are contributing a lot. And then another mandate which I can't forget, when we appoint, we have also the mandate as a Health Service Commission to disappoint. Disappoint by disciplinary action. We take disciplinary for those people who are liable to be disciplined, those who can't abide by their expectations to work. So once we decide and then take an action, we can also remove the officer who was appointed in that office. Allow me to summarize. Our vision is a fully resourced health workforce that is responsive and effective. Our mission is to build a fundamentally strong and competent human resource base for efficient and health service delivery. So when they talk about all the other words, they talked mostly, like 80% was praising you. Health workers, we thank you so much. We thank you and we are humbled before you that you are doing a lot. But the other 20% where we have the gaps and where we have to stand and turn them into the opportunities to improve. Together we can improve and go far. In line with our mission and our objective of this conference, I stand before you to make a firm commitment that from here, since we heard that the midwives, it ranked a very high toll there, when there are three things we work with, when the Ministry of Public Service has cleared you for appointing, you have your wage well saved, and then you have submitted and prioritized well according to the decisions and the action point we have gone with here. Our work will be made easy as Health Service Commission to recruit on spot that you have submitted for us rightly. So for us is to recruit according to our mission and vision. The moment you have a wage, you have a vacancy, it has been cleared, and then you submit rightly all the midwives. I think we shall do our due diligence according to the new structure, new staffing structure, and the scheme of service. We pledge to do our due diligence and serve you as it takes. The Health Service Commission is committed to prioritizing the recruitment as mentioned. We acknowledge the immense challenges. I've already talked about them. When we acknowledge those challenges as we walk around, we face daily with you the long hours you stand, the resource constraints, the emotional toll. Please be reminded whenever you are there that we hear you, we see you, we pledge our continued support wherever we can as Health Service Commission. We will continue to operate with our integrity, professionalism, and transparency as we, work with you in partnership because we can't work alone. While we face those challenges, I think we see way forward as positive because we shall stand on them as a firm foundation to find solutions. Once a challenge is found, the solution will be found. In conclusion, I thank you once again for your dedication. Let us live here reminded that safe motherhood is a business for us all. At every age category, it doesn't segregate. The Commission will play its part in strengthening the human resource. I encourage each one of us also to play our part, to collaborate and hold each other's arm and be accountable. I've said all this for God and my country. Thank you for listening to me. The name is what? Allow me to take this singular honor and opportunity to invite the chief guest, Boa Jan Sweding, the deputy head of mission, head of cooperation. Kindly, sir, you are invited to talk to the House. Thank you.
Thank you very much, and I apologize for all these difficult names our parents have given us. Good evening. I stand on the protocol that has been expressed so eloquently already over the last 3 days, and I recognize the presence of all of you, because you have safe motherhood at heart. Thank you very much for that. The Netherlands at present is the chair of a group of development partners working on sexual reproductive health and rights. And I'm deeply honored and pleased to provide the closing remarks of this conference. I congratulate the Ministry of Health, the National Safe Motherhood Committee, and all partners involved for a successful delivery and conclusion of this 5th National Conference on Safe Motherhood. To all attendants, your presence made a difference, and your contribution through the last 3 days is very much valued. We view this as a demonstration of your unwavering commitment towards this great cause. It's extremely appreciated. The conference has brought us great insights to what could be done to strengthen multisectoral collaboration and mutual accountability for safe motherhood. And it is our hope that you leave inspired and that lessons and recommendations from these past 3 days leads to a new horizon for women and girls. And I'm very pleased to see that during the synopsis, and thanks to the Icelandic ambassador, we already have the theme for next year. We have the solutions, time for action. And I think for the committee can that team on board. Through the 3 days of the conference, some messages kept resounding. And allow me to use this moment to mention some of the important ones. At first, safe motherhood is not only a women and girls matter. It's for men and boys too. A world that is safe for mothers is safe to all of us. We men, we boys, we have a responsibility to play. We cannot underscore the significance of involving men and boys in this journey to secure a Uganda where motherhood is safe and a joyous experience for every woman. It's important to keep the gender lens in all our efforts. Secondly, and I'm very pleased that partnership came across already during this closing event, while a strengthened multisectoral collaboration and mutual accountability is a potential game changer, strong leadership, both political and technical, at both national and subnational level, is the fuel needed to make this happen. Thank you very much, Ministry of Health. Thirdly, safe and healthy adolescence is a strong foundation for safe motherhood. The high occurrence of teenage pregnancies, child marriage, and rising cases of HIV new infections, especially among adolescent girls and young women, are indicators of an urgent need for a strong multisectoral collaboration and accountability for health and well-being of adolescents. And we all still remember the spoken words artist that we had this evening. Finally, while we explore options to secure increased funding for health, we need to deepen accountability for efficient use of available resources in every process and activity, including conferences and trainings we engage in to improve health and health outcomes. We should always choose the most cost-effective option and choose for value for money. Ladies and gentlemen, the conference has reminded us that safe motherhood is a right. We are the duty bearers and have the obligation to protect and fulfill this for every woman and girl in Uganda. When we fail in our duties, they carry the burden of our inaction. I call upon all of you in your respective capacity to play the role you can and make motherhood safe for every Ugandan woman. In the opening remarks, the chair of the Health Development Partners, a colleague of our UNFPA colleague here, expressed the commitment to continued partnership and mutual accountability. At the end of this conference, I am pleased to reiterate this commitment. Before starting the well-deserved weekend for all of you, I would like to thank you once again, using a quote of Henry Ford. Coming together is a beginning. Keeping together is progress. Working together is success. I wish us all that success. Thank you very much.
Another big hand clap for the donor. As I earlier mentioned, the hand claps must be hyperglycemic. So a big hand clap for all the panelists. Your Excellency, I want to thank you. Team West Nile, the money you have for the SRH project comes from the government of Netherlands, from the great people of the Netherlands. They're also a kingdom of Netherlands. And we want to thank Judith, who is also a minister. Judith, stand up and we clap for you. She has been the link between the Embassy of Netherlands and the Ministry of Health. Thank you so much, Judith. Our friends, our distinguished panelists and chief guests, I want to request that we take a picture with the organizing committee. They have done so much. They've been to your offices for the support. Organizing committee, please, we want to end this session. If you can do it in 1 or 2 minutes, please step here. We are slightly behind time. We still have dinner and awards, and we shall do those in 30 minutes, both. Organizing committee, only those who are available. Our dear distinguished chief guests and your team, I request that we step here and have a picture. Organizing team, don't use this picture for alone, because it has donors. Yes, the transition between the organizing disclosing ceremony and you can use even the stairs. I don't know if it works. Some of us are above sea level, we can see tomorrow. Those who are above sea level, you go down. Thank you, Emma. Emmanuel is our PRO Minister of Health. We appreciate you for coming. We clap for this team. They've done a great job. Me, I'm above sea level. They will see me. Oh. Thank you, organizing committee. Our distinguished guests, you can take your seats, your former seats. We want to really to appreciate you. Thank you, organizing committee. Next year, do better than this. I think we shall have even Zoom cameras and everything. We really appreciate it. The cultural group, kindly manage the transition. We are allowing you only 5 minutes as we reorganize now to go into the awards. We have ticked off the conference with the summary of the events, the summary of the key points from the conference. We have now ticked off the closing ceremony. We are remaining with only the awards, and the chief guest for the awards is already here with us. I hope she's not looking at the time. The chief guest for the awards cultural team, Dr. Bagala, should just 5 minutes only just to, and feel free to stand when the culture gets into your head or the dance gets into the culture. Feel free to stand. We are using this time to reorganize very quickly. The team in charge of the awards. As routine, this is the only conference that you hold as the Department of Reproductive and Child Health. We combine everything, awards, dinner, conference. So next is the team that is handling the awards, led by Pamela and Dr. Andrew. And the cultural team, please, if you don't have music, me, I can begin my culture because I'm also a cultured man. I'm a minister in Toro Kingdom, so I can begin my culture. And cultural team, take over. Emmanuel Aineviona, I want to invite you. Aha. Emmanuel Aineviona, our doctor by association.
Thank you very much. Give them a round of applause. That was a commercial break. Good evening, everyone. At least say bonsoir to your neighbor. That is the French word for good evening. So you are welcome. This segment is the award ceremony that will be transitioning into dinner. And I have the honor and opportunity to invite Pamela, who is going to guide us through this award ceremony. Today I don't have much work to do. Pamela is going to lead us through this ceremony. Thank you. You're welcome.
Thank you very much, Emmanuel. Good evening, ladies and gentlemen. All protocol observed. We welcome you to the award ceremony for the National Safe Motherhood Conference 2025. Without a further ado, we are going to begin our program. We will begin with a word of prayer that I'll quickly give, and then we'll have the national anthem sung because our guest of honor was not here at the beginning of this function. Could we please stand up for a word of prayer? Father, we thank you for gathering us here again. We thank you for the gift of life. We thank you because you have appointed us to serve your people. We pray for wisdom, we pray for your grace and for your favor. And as we begin this ceremony, we ask of you to bless us and to bless everybody we are celebrating. And we pray that you be with us. In God's name I prayed. Amen. So you're most welcome. We'll have the anthems already. DJ, please. We'll only have 3 anthems: the national anthem, the East African anthem, and the Buganda Kingdom anthem. Just one stanza. Thank you very much. Before we could sit, I'm sorry, I'll make you stand again. In the past 1 year, we have lost some of our foot soldiers. Some of them have rested while at work in line with duty. Some of them have rested off duty. And we have also lost our mothers and babies in this motherhood journey. We would like to observe a special moment of silence for them, and we pray that their souls will be rested in peace. Yes, DJ, you are on the right slide. The next slide. These are some of those we have lost. We lost our own at the Ministry of Health. We lost some of those. We lost some midwives coming to attend this conference. And we pray that their souls will be rested in peace. Eternal rest grant unto them. May your perpetual light shine upon them. May they rest in peace. Amen. Kindly take your seats. We welcome you all to this 2025 award dinner. And this evening we'll run through very fast. But before we go, I would like to take you briefly through how we came up with this. This was an initiative by our leader. I believe we all know how passionate our leader, Dr. Richard Mugahi, is about safe motherhood in Uganda, and he really would like to appreciate and recognize all his foot soldiers at all levels and all cadres. I believe over the years you have noticed that the trends keep changing. We keep including those that are directly involved in care, but we also know safe motherhood goes beyond just the midwife, the obstetrician. It includes the ambulance drivers, the VHTs, neonatologists and neonatal nurses. We also have adolescents. We have a whole different web of people we work with. So this year you'll notice some cadres have been added, but subsequently we'll keep on trying to ensure everyone is brought on board. So without a further ado, I will be requesting the following people to come and support us with awarding. Douglas Akibua. We are going to run through the different LMNSs and we'll be displaying those that went through. This will be read by Dr. Jacqueline Akello. LMNS coordinators, kindly be ready to move as fast as you can. You'll be receiving these certificates of recognition for all the winners across the different LMNSs. Thank you.
Went through the process. Voting, registration, and then the Okay, thank you, Pam. I write on the existing protocol that was started on Wednesday. Let's welcome Dr. Akiwa. So the process of awards
just briefly, we sent out nomination links to the different LNMSs, and people nominated the people who were performing or excelling in their different regions. After that, the list was vetted by the committee, and then we had another link sent out for voting. And so from each LNMS, we have the overall winner, and then the rest who made it to the nomination link get certificates. So the first category we are reading are those who made it to the nomination link, and then the overall winner will be announced later. So that was the process. Although we also have other special categories that did not come through the LNMSs. So we have Busoga LNMS. Let's have the LNMS coordinator for Busoga, Dr. Agri Bameka. Then we have Yumbe LNMS, coordinated by Dr. Nzama Wilfred. And then we have Arua LNMS, coordinated by Dr. Fayo Victor. And then we have Kampala LNMS, coordinated by Dr. Nanzira Rachel. Let's have the four. So I'll start with Kampala LNMS. The people getting the certificates, we have the obstetrician, Dr. John Wanyama from China, Uganda, Naguru Friendship Hospital. The medical officer who was nominated was Dr. Matthias Lugolovi from Kasangati Health Center 4. And the DHO who made it from Kampala LNMS was Stephen Mulindwa from Mukono District Local Government. And then the neonatal care nurse was Sister Claire Ahimisiwe from Mulago Specialized Women and Neonatal Hospital. And then we have Sister Abigasi Nalugwa from Kawempe National Referral Hospital. And the anesthesia and anesthetic category from Kampala LMS was Farida Muhindo from Kawempe National Referral Hospital. I'm also from Kawempe. And the implementing partner who got it to the nomination list from Kampala Metropolitan was Save the Children. So we will also need a representative from Save the Children. So we'll ask Dr. Akiwa. I think you're also receiving on behalf of Save the Children. Okay, so we'll start with the IP. So let's start by awarding Kampala LNMS. Dr. Akiwa can handle. So we expect that the different LNMSs will also organize a ceremony to recognize the names that have been read. But when we send out nomination links, we expect better competition. You realize the LNMSs that are getting 5 certificates, others getting 8. It totally depends on your participation as an LNMS. Okay. Next, we shall have Yumbe LNMS certificates. Yumbe. Yumbe, can we have the names for Yumbe, the obstetrician, Dr. Wilfred, who is also the coordinator, the pediatrician, Dr. Mubarak Nasur, the midwife, Sister Sally Aikoru, from Yumbe Regional Referral, from Koboko General Hospital, and the medical officer, Dr. Alex Dramadri, from Midigo Health Center 4, the DHO, Dr. Dennis Oloya from Koboko, and then the neonatal care nurse, Christopher Waswa from Moyo General Hospital, and the implementing partner who won from Yumbe is IRC, International Rescue Committee. We appreciate you for the support. Okay. Let's have Arua.
I've been requested that the teams that you're reading that they have won, they can come here just and we clap for them because people would like to. It would be nice. I know it takes a little time. As a way of appreciating you.
Okay, can we
as you prepare to come, let me read the remaining two, but we'll have the teams come and take photos with our guest of honor. Okay? Arua LMS, the coordinator, Dr. Fayo Victor, was nominated as the obstetrician. The pediatrician, Dr. Anniku Gilbert from Arua Regional Referral. The midwife, Sister Julie Adokorach from Nebi General Hospital, Naimenti. The ADHO, Sister Jessica Draru from Maracha District Local Government. The neonatal care nurse, Sister Ngamita Jane, Arua Regional Referral. And the anesthesia, we had William Ochen from Omugo Health Center 4. Please prepare to come forward to take the photo. Arua LNMS did not nominate an implementing partner to be awarded. Okay. Next, we shall have Kampala LNMS list. I think I read Kampala already. Okay. So the photo. Busoga, oh yes. Busoga, the obstetrician, was Dr. Susan Chizala. Pediatrician, Dr. Emmanuel Tenywa from Jinja Regional Referral Hospital. Midwife of the year from Busoga, Sister Veronica Sempa from Chidera Health Center 4. DHO from Busoga Region, Moses Luja from Kamuli. Neonatal care nurse, Sister Mubarak from Jinja Regional Referral Hospital. And finally, the anesthetic officer of the year, Olivia Najuko from Nankandulo Health Center 4. Thank you so much for your participation. Can we have the different groups come forward? Kampala, LNMS, and all those who were awarded the certificates. Please, if you're around, come forward. Dr. Rachel and team, give them some music, DJ. Where are my Kampala people? If not, I will receive on your behalf. As Arua prepares, come forward if you're from Arua. Kampala. Arua team, move closer. Team Arua, please move to the stage. Okay. As Yumbe prepares, Yumbe, move on stage as Busoga prepares. Dr. Bamekan team, prepare to come forward. Team Busoga, led by Dr. Bameka. Busoga, Dr. Kizala and team. So may I invite Rita to come and take us through the next category. Good evening. I'll be reading the winners from Masaka LMNS. Gynecologist, we have Dr. Tony Mawanda. Pediatrician, we have Dr. Peace Nambusi. Midwife, we have Sister Sarah Nakajigo. Medical officer, we have Dr. Deo Gracious Kalinzi. Joel Harriers. ADHO, we have Sister Constancio Nachitio. DHO, we have Dr. Charles Matobu. Neonatal nurse, we have Sister Speciosa Amoit. And I'd like to invite the LMNS coordinator for Masaka to receive the certificates for the winners. Congratulations.
Masaka team, if you are here, please come forward so that we take the picture and you go back so that we don't have the... We need to save time. Dr. Senyondo and your team, step forward. Our chief guest kindly and our minister. Let's have a picture with the team Masaka. Apologies. And you'll be reading the next one.
The next group is Bunyoro, so Bunyoro team and your LMNS coordinator, be ready. The one who will be awarding the next category is Miss Juliana Luguzi. Bunyoro winners, gynecologist Dr. Sebwami Leonardo, pediatrician Dr. Oburu Geoffrey Ofumbi, midwife Sister Kabasomi Penolo, ADHO Kugonza Susan, DHO Dr. Sabiti Edward, neonatal nurse Ayebale Immaculate, anesthetist Akusekera Unia. And as they're receiving their awards, Renzori LMNS.
Great.
Please, when you hear your name, man.
Let me provide further guidance. We want to go through this very fast. If we are going to tell you, like now, after Bunyoro, we announce it too. After Bunyoro is Rwenzori. After Rwenzori is Kayunga. We expect everyone to be in the hall. If we call your name and you're not here, we go on to another group. Thank you very much.
Going on right here, a celebration that lasts throughout the year. So bring your good times and your laughter too. We gon' celebrate your party with you. Come on now.
Miss Renzori, Miss Liliana, yes, yes. Renzori Gynecologist, Dr. Martin Ouna. Pediatrician, Dr. Beatrice Chomgisha. Midwife, Kabasita Beatrice. ADHO Muhindo Zura. DHO, Dr. Amon Bwambale. And neonatal nurse, Bira Penina. IP, Annabelle. Please run in case you're in the room. The next one is Kayunga.
It's a celebration. Let's celebrate.
Kayunga, prepare to come, and I'll start reading the winner so that you prepare to come. Gynecologist from Kayunga, Dr. Susan Tusubira. Pediatrician, Dr. Gloria Nakalema. Medical officer, Remy Ndianabo. ADHO Florence Namuyanja Ziwa. Neonatal nurse Rose Biabwa. Anesthesiologist Okia Moses.
Welcome. Don't walk it, don't drive. You're supposed to be jive. You look on me for best name, I love best name with no man. When I had the land softly on the sofa floor. So far, so good. Money back out, let me see.
The next region is the Elgon region for gynecologist / obstetrician, Dr. Emmanuel Tisime, pediatrician, Dr. Julian Abeso, medical officer, Dr. Susan Lunyolo, ADHO, Stephen Wanyala, DHO, Dr. Ephraim Nakoko, neonatal nurse, Sister Goreti Ayebale, anesthesia, Thomas Boyo, and their implementing partner, Seed Global Health. Ankola region, get ready. I would like to invite Irene Atkaire from Seed Global Health to come give out these awards, please. Miss Irene Atkaire. From the Ankola region, the following people get ready for gynecology and obstetrician, Dr. Fiona Asimwe, pediatrician, Dr. Mike Chewalianga, midwife, Sister Francisco Akampa, medical officer, Dr. Albert Alinda, DHO, Dr. Peter Sebutinde, neonatal nurse, Bashirat Sime, anesthesia, Ruth Charikunda. Irene Athaire from Seed Global, please come give out these awards. Next, we shall have Shigezi LMNS. Please get ready. For gynecologist, Dr. Patrick Komagumu, midwife, Sister Devota Oyesiga, DHO, Dr. Gilbert Mateka, neonatal nurse, Sister Komjuni Naevare, anesthesia, Benny Kamagaju. Chigezi, LMNS. Next, we shall have the TESO LMNS. Please get ready. TESO region, gynecologist, Dr. Jackie Angwet, pediatrician, Dr. Moses Ochora, midwife, Sister Jen Akelo, medical officer, Dr. Annette Katsime, ADHO, Jude Olede, neonatal nurse, Sister Deacon, anesthesia, Joseph Eriapu. TESO LMNF.
So the next set of awards we have Lango, Acholi, Karamoja, and then Mubende. And I don't know if Joy Batusa from Chai is here. I want to welcome you on stage to hand over the next set of certificates. If Joy is not here, then we can continue with the... Great, so we have the awardees from Lango, obstetrician and gynecologist. We have Dr. Ben Aiko. The pediatrician, we have Dr. Julie Ochol. The midwife is Stella Akite. Dr. James Olum as our medical officer in Lango. And then we have Semi Achiro, the ADHO. Dr. Jimmy Odongo from Amolatar as the ADHO. And then in neonatal care nurse, we have James Opio. Our implementing partner from Lango is Quam. Lango team, please come on board and we hand over the certificate. The Acholi team, please get ready. Come on board. So for Acholi, we have Dr. Geoffrey Akena as the gynecologist. Please step forward together with your LMNS coordinator. The pediatrician is Dr. Maurice Okao from Ambrosoli Hospital, Kalongo. We have the medical officer as Dr. Job Aeku Michael. The ADHO is Sister Grace Anena from Gulu. Dr. Dennis Ochula, the DHO from Kitgum Municipality. We have the neonatal care nurse being Albert Okanya from Gulu Regional Referral. The anesthesia or the anesthetist is Francis Okech Ouma from Gulu Regional Referral. And the implementing partner is APSI. Actually, team, please. WHO kindly join us forward. WHO. Karamoja team, please get ready after this. Karamoja. Yes, we have Dr. Asa Sebuku as the gynecologist from Moroto Regional Referral. We have the pediatrician, Dr. Doreen Faith Longes. Midwife is Sister Fausta Aburu from Namendera Health Center 3. The ADHO is Sister Deborah Achia from Kotido. The neonatal care nurse is Sister Ruth Achom from Matany Hospital. The anesthesia or the anesthetist is Paul Nelson Maruk. The implementing partner there is also Quam. That certificate is also included there for Karamoja. Please step forward. The Mendes team, please get ready. Our gynecologist is Dr. Isagara Peter. The pediatrician is Dr. Immaculate Mirembe from the Regional Referral Hospital. Our medical officer is Dr. John Yahweh from Sekanyonyi Health Center 4. The ADHO from Mubende is Sister Sarah Naskombe. I hope I got that right. The neonatal care nurse is Sister Anne Kakara from Mubende Regional Referral Hospital. And the anesthetist that took it from Mubende LMNS is James Wabuya, and the implementing partner is Alive. Mubende LMNS, please step forward. So I want to say congratulations to the different LMNS winners. Those who have gotten certificates, you emerged as the best from your LMNSs, and I want to congratulate you so much. So the next set of awards are the special categories, and I would want to welcome with me back Dr. Jackie back on stage to take us through the best of the best from all the LMNSs to receive the plaques. Dr. Jackie.
Thank you, Dr. Emina. So the next category are those who emerged winners, and they're getting the awards for their LNMSs, and we have one per LNMS, and I would like to invite, Dr. Grace Mulinda from World Bank to award that category. So let's have the first LNMS, Tier 1, Outstanding Individual Organizations and Entities. Let's go to the first LNMS. Okay. Recognition for outstanding contribution to safe motherhood, Lango LNMS, and the winner is Nelson Loka. Nelson is an anesthetic officer at Anyege Health Center 4 in Oyam District, stands out as a champion for safe motherhood in the Lango LNMS. With over 11 years of service, his work in obstetrics, anesthesia, and swift response to maternal and newborn emergencies have saved countless lives. Let's play for him, Yoleng. He comes from my region. Can we have Nelson's award, please? Lango LNMS. Okay, recognition for outstanding contribution to safe motherhood from Mubende LNMS. These are people who got the highest votes. Ruth Chazike. Ruth is passionate midwife with over 2 decades of service. Ruth, I'll not be able to read the entire profile because you're able to read. It's the same. Let's have the next LNMS. Okay. The winner from TESO LNMS is Dr. Joseph Emron, who is a medical officer and the acting medical superintendent of Katakri General Hospital. Dr. Emron.
Let's celebrate. There's a party going on right here. A celebration for the year. So bring your good times and your laughter too. We gon' celebrate your party with you. Come on now. Let's all celebrate and have a good time.
Okay, let's have the next. The winner from Kayunga LNMS.
You, what your pleasure is all about.
Kayunga LNMS. Grace Jessica Zungu, who is a nursing officer from Kayunga Regional Referral. Because of time, we are not reading their profile, the entire profile, but hoping you can read through. So for all those who have received the awards, please come forward. We shall take a photo with the chief guest in your different categories. Okay, next we shall have the winner from Chigezi LNMS. Chigezi, Dr. Godfrey Amoti Wampiri. Can we have some music as Dr. Godfrey comes? Please, if you've received a plaque, come nearer. We're going to take a picture with the guest of honor.
Let's all celebrate and have a good time. Yeah, yeah. We gon' celebrate and have a good time. It's time.
And lastly, for the first 6, let's have Renzori LNMS. All those who have received the awards, please come closer. You're going to take a group photo here. Okay, for Renzori, Dr. John, no, not John Bosco. No, John Bosco is not Renzori. Renzori is supposed to be Dr. Herbert Nzeke, not Oriema Bosco. Dr. Herbert, I know him very well. You're most Renzori LNMS.
Kuba niwe niyo shongare babaziro bamanyise nokamane papa sotija kwechangane bikuru syambe mazire nihombose kazobo bukwe pankandi barunzwara ndahire wenda kwiruka wenda kuzana ningo kwegama onyete nkubanjire
Masaka LNMS. Sarah Harriet, Senior Anesthetic Officer. Can we have this? After Sarah has received her award, come and take the group photo, please.
May I
request the first 6 who received the awards to come for the group photo with the chief guest? Please. Please play for us a song as they come. The first 6. Dancing. It's not easy to get a Safe Motherhood award. DJ, please. The song is not for dancing. Add more vibe. When you're done with the photos, we have bags for you. We have a white bag. So Professor
Joseph Atviamjisha, if he's not here, Professor Nachimulis, kindly step forward. Dangerous substitute.
These are the winners in the overall LMNS. Yes. Recognition for outstanding contribution to Safe Motherhood, Bunyoro LMNS. The winner is Dr. Lawrence Kamya. He's a dynamic Ugandan physician with 5 years experience, with a 5-year journey in Kakumiro district. Let's clap for him. Please clap as he's coming.
Dr. Lawrence, don't go away afterwards. Stay a bit near so that we can take an overall photo. From Kampala Metropolitan LMNS, the overall winner is Prosi Nabweteme. She's an innovative midwife from Wakiso Health Center. So please clap for her. DJ. Give Sister Prosi some vibe.
I want to flex my love. I want to impress.
Please let's clap for Sister Prosi.
With this she loves. I want to impress. And I want to carry my love away. With this she loves.
Sister Prosi, after don't go very far, keep her feet close. For the general photo. Don't go very far. The next winner from Acholi LMNS, drum roll please, Rebecca Aliemo. Rebecca is a devoted midwife at Okinga Health Center 3 in Pada District. Let's clap for Rebecca. DJ please.
Nyoro kara kara, jatani nyoro kamarati nyoro machi nyoro kwa. Yoleng, yoleng maro kara kara, yoleng, yoleng maro wara, yoleng, yoleng maro kara kara, yoleng.
Please send me up. Please don't go very far. Don't go very far. We are going to take an overall photo. The next from Karamoja LMNS, our overall winner is Dr. Longiro Mark. Please, a big hand clap for Dr. Mark. Dr. Mark, congratulations. He is a frontline health worker and transformative leader advancing maternal and newborn health in Karamoja. He works at Nabila Health Center. Please, the hand clap for Dr. Mark.
I see this fine girl for my party, she wear yellow. Every other girl they do too much, but this girl mellow. Now in my fine situation, I go use this girl mellow. Finally, I find way to go
from Elgon LMNS. The overall winner is Edith Akello. A big hand clap for Edith Akello. Edith is a devoted midwife from Bosano Health Center 3, Mbale District, one of Uganda's most hard-to-reach communities. Let's give a big hand clap to Edith Akello. Congratulations, Edith. Well done. Edith, don't go very far. The next winner from Uncle MNS. Drum roll, please.
Calm down. This your body, you put him out for lockdown, for lockdown.
Uncle MNS.
Yo, you feel like
Sister Chemist Beatrice. A big hand clap for Beatrice. Is Beatrice around? No. Beatrice is, yes. Beatrice is ADH Obuntungamo. A big hand clap for Beatrice. If Beatrice is not around, the LMNS coordinator, you can come and pick Beatrice's award. Partner from Ankole. Award to be read by Vanessa. has got an award to come and we take an overall photo as Vanessa reads the next winners.
The awardees kindly step forward, and our chief guest will take a picture. Vanessa, prepare yourself for the next phase.
Good evening. The next award category is for Busoga LMNS. Can you please have Mr. Kenneth Mtesa Sira from WHO to join us on the stage? The first awardee is Dr. Peter Diogo Nantamu, the DHO Ginger. Then we move to the next recognition is from Yumbe Element. Can we have Mr. Lulu Henry Leku, the ADHO of Ajumani District? For Bunyoro LMNF, the next award category, we have Dr. Lawrence Kamia, a physician from Kakumiro District. He was awarded. Then we move to the special categories. Recognition for outstanding contribution to safe motherhood, adolescent health. We have Mr. John Stephen Asimwe, head teacher of Busiro Church of God Primary School. Yeah, it's okay. The next recognition is for Best Data Officer for Blood Products, Mr. Kainamura Mbiro Innocent. Mr. Kainamura Mbiro Innocent. The next recognition for outstanding contribution to safe motherhood, ambulance driver, Mr. Francis Chazima. Mr. Francis Chazima. Can we have all the awardees come to the front for a group photo?
What's next? What's next? Thank you. A big hand clap for this team.
Special awards.
Special awards. And I want also to mention that amidst us we have one of our own doctor who is also a musician, Mr. Kachumbala, Dr. Kachumbala. Kachumbali. So he will be entertaining some of our special guests as we continue with the awards. Pamela, can we have the next?
Okay, ladies and gentlemen, we are going to now go to the next category of special awards. As these people come in, let's cheer them up. They deserve it, and I will invite Mr. Kenneth Akiri to come and hand over these special awards. So the first one will be recognition of outstanding contribution to safe motherhood, the corporate social responsibility. Ladies and gentlemen, our awardees for this year is URSB. As you all know, this is a statutory body championing commercial and intellectual property, and it has extended impact beyond business to now saving lives. A round of applause for URSB. Let's clap for them as they take on this award. If the music is nice, you can dance to it as they take the photo. Okay, the next group of our deal is the recognition for outstanding contribution to safe motherhood. ADH Clinic of the Year, Adolescent Health Clinic of the Year. Ladies and gentlemen, the Yumbe Regional Referral Hospital Adolescent and Youth Friendly Clinic. In just over 2 years, the clinic has transformed into a safe, vibrant space where young people find care, confidence, and community. Let's give a round of applause for them. Yumbe, DJ, play for them a song. LMNS coordinator with your team, Dr. Commissioner Nancy. Okay. Girl, I'll be foolish if I don't let you indulge me. Ladies and gentlemen, our next category of our D is recognition for outstanding contribution to safe motherhood implementing partner. Let's welcome CHI, Clinical Health Access Initiative, for the grateful work they've done in the last year when it comes to safe motherhood. Team from CHI. Colleagues, as the DJ plays music, you can clap, you can stand up, and thank for them as well. Clap for them. They've done a great work. Okay, our next awardee is going to go to another implementing partner who has done outstanding work in the Renzoli region, and that is none other than Enable. Through their support of We Care project funded by the Kingdom of Belgium, they've been able to penetrate Renzoli region and have done tremendous work over the last year. So let's clap for them as they come to receive their award. Now we go to the best performing NASMEC subcommittee. This one does not mean others did not do well, but we've had excellent work from all our subcommittees in the last 1 year, but we could only have one that stood out. So allow me to welcome the National Newborn Working Group. For the first time, they did tremendous work. They've trained over 100 healthcare workers in neonatal in-service training. They are soon to graduate the first cohort of neonatologists trained in Uganda. And also they have activated the regional LMNSs, specifically for newborn. Dr. Teo and your team, and they have been give them a round of applause. They won first work over the last 1 year.
She said, I'm my love, you belong to me, and I belong to you.
That's like a winner.
You got killing somebody. Me say love is blind, but I didn't see her for
my group is First Pride, and I think it has been down the network care is being provided. So when among them we have some new cohort of neonatal fellows, so once they graduate we shall have over 10 neonatal fellows graduating from them. So colleagues, I want to proceed to the next cohort of awardees. After the photo, you can now walk. We shall not play a song for you. You've already won. Okay, colleagues, our next awardee goes to the outstanding contribution to safe motherhood under the PNFP of the year. We appreciate the work all our PNFPs are doing in the country, but for this year, we wanted to give special recognition to Holy Innocents Children's Hospital, the only specialized pediatric facility in southwestern Uganda. And they've done a tremendous work in providing newborn care and child health care to the entire region. And you know, through the excellent NICU, state of art with CPAP machines and the rest and high quality instruments, they've been able to do great work. A big thank you to Holy Innocents Children's Hospital. Allow me now go to LMNS of the year. Out of our 17 plus LMNSs, we had one LMNS that stood out. And interestingly, it's among the youngest LMNSs, JP Farm Right. A round of applause to Yumbe LMNS. Yumbe LMNS, LMNS coordinator, our obstetrician. You can come with your pediatrician who is championing the newborn. Thank you so much. The Yumbe element serves the largest refugee population as well in the country. Over 600,000 refugees from the districts of Koboko, Yumbe, Kongi, Atumana, and Boyo district. Congratulations to Yumbe LMNS. This shows how powerful the LMNS is. So probably next year we shall see more energy. But also we want to see the trends now falling. Maternal mortality, neonatal mortality, and everything.
Punguza kidogo na mengine kadhalika.
Okay, colleagues, we've had tremendous improvement in neonatal care in the country, and there is one outstanding mentor who has moved to facilities mentoring our midwives and nurses all over the country. And this award goes none other than Sister Damali. Sister Damali Mogerera. Sister Damali, do we have you here? Let's clap for Sister Damali. She's done great work. If you're in love of newborn care, let's clap for her. She comes to pick her award. Sister Damali is being escorted by a very huge army. I think they must be portraying us. Probably next year we shall have some of them being awarded as well. Congratulations, Sister Damali. As I wind my duty here, ladies and gentlemen, we have one outstanding pediatrician who recently concluded her fellowship in neonatology. But besides that, she has done tremendous work in mentoring fellow doctors in neonatology. And allow me invite Dr. Anita Tumwebaze, who has excelled as the outstanding mentor in the category of pediatric and neonatology. She's very passionate and she's dedicated to improving newborn survival and quality care in Uganda. Colleagues, do we have Dr. Anita around? Oh, I wish you had a representative. Whoever loves Dr. Anita, come and receive an award on our behalf. So many will come and go. Come see your baby mama is a triangle. Okay, so I'm going to, we have Pamela who will read out our last person. Then I will ask all our awardees in this category to step forward. We have a photo together with a guest of honor. Don't forget to pick your bags. Congratulations once again to our awardees of the year. Let's go.
Thank you very much. The photo moment for this team, please. Kindly walk up very fast. The hotel, I am very disappointed in you. I requested you to change the lights. I think this is why people are not clapping and getting excited. Kindly turn on the lights so that we enjoy the moment. We've been having this light for the whole conference. I beg that you change and put our mood into a better mood. Hotel, please, this is for you. Speak Resort Munyonyo. And before we go to the next, we'll have a mentor. But before the please, our Ds come on. We take the photo moment and we go. The next will be read by our PPA champion. She will be awarding our next set of awardees with Mr. Kenneth Akiri. You'll kindly stay here. And in this next category, please, the ones who are red, kindly increase the speed. The hotel, I am still waiting until you turn on my lights very well. I will not stop mentioning it until it's done. Except the photo is not carved very well. Commission, I think we need to make a straight line so that you appear in the photo very well, sir. So thank you very much, team and colleagues, to you all. We celebrate you. Continue the good work. Let us celebrate them, please. So in this next category, we have one special person. This person has gone beyond and over himself to train other anesthesiologists. He is also a call away in case of emergencies. And if you want to see his energy and passion, call him and tell him he needs to resuscitate someone. He will do it over and beyond himself. But interestingly, he is also a very serious professional DJ. Ladies and gentlemen, welcome with me none other than Dr. Agri Lubikire, the senior anesthesiologist from Kawempe National Referral Hospital. In the night, he's also called DJ Happy. DJ, please do not bore our DJ. His birthday cake always has his tools and his stethoscope. You have known Dr. Happy. We congratulate. Congratulations to you, Dr. Happy. Our PPA champion, you're supposed to kindly be walking up here to award. No. So the next is tier 2. Who are the champions? Thank you very much. In this category, we have people who have outdone themselves. We know in the different categories and workplaces, we have different energies, we have different things we put out to the table. But for this special category, they surely deserve a hand clap. I will not allow them to move if we are not clapping and applauding them. If you could please stand up because they have really outdone themselves. And the first champion is none other than Agnes Nambozo. Agnes Nambozo is a midwife from Bulambuli district. She has been cited several times climbing over the mountains, single-handedly, not facilitated, to go and reach MNH services to the people in the hard-to-reach areas. She is the best performing midwife. It is unfortunate that Sister Nambozo could not make it because she has an exam, but she sent this lady to represent her. However, Nambozo has been the best midwife and the best health worker. We appreciate you and we are proud of you. May the lives you serve, may the Lord count every good thing for you on the different lives you serve. We'll straight away move to another person who has also outdone themselves. The next champion who has outdone herself is Miriam Lokwi from Karamoja. She works at a health center 3. For those of you that have been to Karamoja, you know how hostile, if I could use some communities, can be. This lady is being awarded for her bravery during an emergency with PPH, where the community had refused to take a mother to the hospital, and this lady walked there with police and requested, with her skill, requested and explained to them what PPH was and that it was not witchcraft or anything, and she was able to convince this mother to come to the facility. And because of this, the whole community has believed in her. They always congratulate her and they do everything that she requests. Miriam Lokwi, unfortunately she's not here, but Kwam will receive it on her behalf. We appreciate her so much. Thank you, Team UNFPA, for the beautiful gift you're giving them. Let us move to the next champion. Vanisha Mugide is also one of those beautiful champions from the islands. She has been seen several times referring mothers on a boat, holding their drip and trying to resuscitate them as they move these mothers to the next level. Vanisha Migude, you're amazing. The Ministry of Health honors your work, and we pray that God will bless you for the extra hand you give. Let us give them a very huge round of applause. For this next category, I may not be the best person to relay this. I request my boss, the commissioner. Thank you very much, UNFPA. Let us have a group photo with our champions. The one who carried the one for Lokwi Miriam and the lady from Bulambuli plus Vanisha, please come over. And the last one, champion, is a lady who has served in the newborn unit for over 25 years. She has been a mother to the babies that have been abandoned. She has been a mentor to mothers who fear small and sick newborns. She has lived over and beyond her means. She's a support staff, but who has special interest in newborn babies. None other than Hasifa Namuli from Kawempe National Referral Hospital. We congratulate you, Auntie Sifa. Congratulations to the team. DJ some music, the hotel, I'm disappointed in you. The next category will be taken on by the commissioner and the chief guest and the undersecretary. Please do not go. And the commissioner will invite our guest of honor to also come and award this category. Madam Charlotte, we request you to come back, please. Thank you very much.
Wow, it's getting interesting. I was waiting for my name, I couldn't hear. But I am a strong believer that those who have not received like me, our rewards are in heaven. Amen. I have seen our rewards in heaven. These lifetime awardees are 3, and they are going to have special songs that they are going to usher them here. DJ can organize the music for these special songs, and I think our very own will also sum it up as we conclude. Prepare, I don't want any lap in this. Prepare their decorations. Prepare everything. If you can clap, you clap. If you can stand, you stand. If you can stamp, you stamp. If you can allulate like Juliana, please do. It's an exciting moment. It's a moment to celebrate achievement. It's collective achievement. We are not saying that you're the only achievers. I want to begin with the first lifetime achiever, Dr. Jamil Mugalu. Dr. Jamil Mugalu is a consultant, senior consultant pediatrician and neonatologist with extensive expertise in neonatal and perinatal medicine. As head of the special care unit and neonatal intensive care unit at Kawempe National Referral Hospital, Dr. Mugalu is a teacher. Dr. Mugalu is a clinician. He has trained most of the doctors in Uganda about neonatology, a very dedicated servant, a honorary lecturer at Makerere University. Mugalu has mentored countless number of professionals, Medical Association of Uganda, championing passionate ethical care. His leadership in clinical excellence, mentorship, and neonatal innovation makes him a standout lifetime achiever for safe parenthood. We congratulate you, Dr. Jamil Mugalu, for being one of the outstanding lifetime achievers 2025. A big hand of applause for Dr. Mugalu. You are the reason why Uganda is excelling. We want to appreciate you. And you remain here with your award. I want to move to the second. As I earlier said, if you can clap, you clap. Miriam Najemba Mwanja. Miriam Najemba Mwanja is a nurse. DJ, please. If you can have a Rusoga song. Is a nurse midwife and a public health leader. whose career has shaped Uganda's maternal and child health landscape. From her days in Mulago Hospital to her days as the district nursing officer. That is what I want to see, the excitement. We honor you, we recognize you, and you are our lifetime achiever for 2025. Incredible performance. Thank you so much. You also retain you. Pamela, decorate her in the white color. She can remove the yellow one. Or she can do both. And I'm moving to the last one. I'm moving to the third lifetime achiever, Professor Dan Kekaye, an outstanding obstetrician gynecologist. Professor Dan Kaye has mentored, has taught in Mulago. He has spearheaded sexual and reproductive health. He has published a lot of literature. He's a moving textbook. He's a moving textbook by himself. Professor Dan Kaye, a very humble man, very passionate about service delivery. Uganda is so proud of you and we want to recognize your outstanding achievement for the lifetime achievement of the year. This is special. I don't know how to make it more special, but please decorate Dr. Kaye, Professor Kaye. I'm going to request that the three stand in the middle. Yes, the three stand in the middle. Thank you. Thank you for your service. Thank you for your dedication. Thank you for your passion. We appreciate you. A photo moment. We want WHO, UNFPA. If there are any other ambassadors who are remaining here, Chair Health Service Commission, commissioners, please join in. Let's make it special for Dr. Olive Sentugwe join us. Commissioner Bafu.
Let us celebrate them, please, with a round of applause. Would like to apologize for the technical glitch. There is an LMNS whose champion was not mentioned, and it would be Dr. Oriema from John Bosco from Arua LMNS. Please move forward for your award, and we congratulate you. Dr. Oriema John Bosco, the Ministry of Health appreciates your work in Arua LMNS. As Dr. Oriema comes up, as Dr. Oriema comes up to receive his word on behalf of Arua LMNS, I request Dr. Ragala JP, who has been the chair for this organizing committee, to come forward and appreciate our different partners. And lastly, I'll have a gift from a former awardee that is going out to the Ministry of Health, particularly to the PS and the Minister of Health.
Right, thank you very much indeed. And I think it's really worthwhile for us to say thank you to the people who have enabled us to be here. And colleagues, ladies and gentlemen, let's put up a round of applause to Baylor Foundation Uganda, who have been our platinum sponsors, for the NSMC 2025. Baylor, 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 Baylor. As Baylor comes, we can have Save the Children, Platinum Sponsor, NSMC 2025. As Save the Children comes, we have UNFPA, Platinum Sponsor. Yes, let's start with Baylor. I think this is Team Baylor, and then Team UNFPA. Dr. Mugahi, please, come and thank your people. Please, please, please. They have enabled us to be here. Okay, fine. Elma Philanthropies has been our gold sponsor. IPAS Africa Alliance, gold sponsor. AMREV, gold sponsor. The Clinton Health Access Initiative. We can get our words and we can keep here for a group photo with the chief guest. Thank you. PSI, UNICEF, Maristops, Uganda, Japaigo, the World Bank, Dr. Mulindwa, the World Bank, Self-Care Uganda, my sister Rose, Self-Care Uganda, the World Vision. What is the World Vision? You did amazing. Stanbic Bank, if you're in the room, Stanbic Bank, DKT, you did amazing. Living Goods, thank you. Yes, Living Goods. And we can now have a photo with the chief guest and the representative of the Undersecretary. Please, with our sponsors who have really touched everywhere in this very difficulty of the stop work order to ensure that we have this mammoth of a conference. And I think you liked it, didn't you? Thank you. Let's take a group photo. We can also use the stairs. We can stand down. All right. Are we fitting in the photo? Let's. There we go. A round of applause to our sponsors. So we can. I don't think someone. Someone's okay. Oh, one of the team. Thank you, Dr. And it's the other batch of partners that have enabled us to be here. The Danish Embassy, Bank of Uganda, Pathfinder International, PATH, the Makerere University School of Public Health Center of Excellency for Maternal and Newborn Care, Nama Wellness, the Global Financing Facility from the World Bank, Mother to Mothers. They're doing some incredible job in Namaingo there. Nakasero Hospital, thank you. Adara, thank you. LifeNet, thank you. Vitamin Angels. Seed Global Health. Kachet Pharmaceuticals, if you're in the room. The World Health Organization. Value Global Health Foundation, and the Reproductive Health Uganda. Thank you. Without your phenomenal support, the 5th National Safe Motherhood Conference wouldn't have been a reality. Thank you very much indeed. Thank you. A round of applause, ladies and gentlemen. They have enabled us to be here for the 3 days. And they have sponsored a number of you, and that's how we made the 1,000 delegates for the NSMC 2025. Thank you, thank you, thank you, thank you, thank you. Thank you very much indeed.
Thank you very much, Dr. JP. Dr. Richard Mugai, please don't go back. One of your awardees last year sent a special gift to the minister and to the PS. I would request that you deliver it to Mr. Kenneth Akiri. He will have it delivered. It was the old lady, the midwife last year, a Lifetime Achievement Awardee, who wrote words from her heart appreciating the recognition. So without further ado, I would request our Lifetime Achievement Awardees, our PPA champion, the guest of honor, Mr. Kenneth Achiri, the Undersecretary for Administry of Health. I would also request Dr. Olaro to come forward and we celebrate our awardees at the cake cutting. All our Lifetime Achievement awardees, our Commissioner, Mr. Kenneth Akiri, our PPA champion, Ms. Charlotte, and Dr. Charles Solaro. To the cake table, please. Dr. Ragala JP, on behalf of the organizing committee, please join the cake cutting team. And immediately after the cake cutting, we'll have a photo moment. Lifetime awardees, Professor Kaye, Dr. Mugalu, and Sister Maria, please walk forward. I'm also reminding all our awardees with award plaques to please pick your paper bags. It might be hard to carry the plaque without a bag. Our Lifetime Achievement awardees, we are waiting for you, please. Dr. Mugalu. I think he has run back to the NICU. It's his favorite place. Professor Kaya is here. DJ, please, some music as we cut cake. Congratulations song. On the count of 3, 2, 1. Congratulations to all our awardees. Congratulations to the National Safe Motherhood Conference 2025. Our guests for the dinner, kindly do not leave. Immediately after the cake, we are having a photo moment. Organizing committee for the National Safe Motherhood Conference 2025. With the team that was cutting cake, please run forward for the photo. Organizing committee. Organizing committee for the National Safe Motherhood Conference 2025. Our PPA champion, I'm sorry, I'm going to get you tired. Our guest of honor, Dr. Richard Mugahi, Mr. Kenneth Akiri. Photo moment with the organizing committee as we walk out to the dinner.
Please, organizing committee, come forward. The last item is going to be dinner. Organizing committee.
We gon' celebrate and have a good time. It's time to come together. It's up to you.
Apologies for photo moment about every photo moment. That is how success is sweet. In my village, we had a saying that success has many grandfathers and failure has no grandfather. If you are short, you'll be in the middle. After this photo, we are going to sit. After this photo, we are going to sit and listen to a few remarks, very the wonderful remarks from our chief guest. First way to take a picture. First way.
Let's celebrate. There's a party going on right here. A dedication to last throughout the year. So bring your good times and your laughter too. We gon' celebrate and party with you. Come on now. Let's all celebrate and have a good time.
Chief guest, I request that you remain behind. Her Excellency, the chief guest. Your Excellency, Her Excellency, the chief guest, I request you remain behind.
It's time to come together. It's up to you.
Her Excellency, the chief guest. Apologies, we delayed you. It was worth it, and we really appreciate you for the time. Let's settle down and listen to the wonderful words from Our Excellency, the Ambassador, and you're welcome, Your Excellency.
Thank you very much. And let me, at this point, stand on the protocol already observed. I recognize it's been very long day and days, and you are probably waiting for the dinner and the occasion to really celebrate each other together. So I will be very brief, and I apologize to the writer of my excellent remarks, that I will then just maybe leave them a little bit. And say that it's really been a pleasure and an honor to be here tonight to celebrate all this dedication and tireless efforts of the frontline health providers. I think it's such a wonderful initiative to take the time to celebrate each other and to recognize people that work so hard every day, and though they might get appreciation from the families and so on, to be brought to this occasion and get this very well-deserved recognition. I have to say it's something we could learn from in Sweden, because I have not seen it there, and it's really a beautiful event. Sweden is in health. We have supported health with a special focus on maternal and infant health for many years. We work on sexual reproductive health and rights. And I was very happy when I saw the awardees today to say that I've been to Kawempe Hospital. I visited the neonatal department. I've seen the maternal department there. I was even there with my minister. I've seen the work that's done. I see how much can be done, but I've also seen the lack of resources and the challenging working conditions that many people still work in. I've also been to the Arua Referral Hospital, and again, been amazed by the dedicated staff, but also struck with still limited resources that are. And as was said before, I am an Alongo. I have 2 boys myself. They were born 1 month early, and I was lucky. I was actually posted to Kinshasa, Congo, but I had the opportunity to go back to Sweden and know that I would be safe and my boys would be taken care of, which they were at the neonatal. So it's a very personal experience when I go visit and when I hear and I know the importance of midwives and all the personnel that works. I want to thank you, the Minister of Health, of course, as well, the leadership provided with the Minister of Health on daily basis, but also to putting us all together for a conference like this. Thank you very much. To all the midwives, you are the cornerstone of maternal newborn care. Your work is truly something special, and there is a lot of positive record to show for that. And also, of course, to all the doctors and specialists here who dedicate their time and skills around the clock to care for mothers and newborn. Some of you might know that Sweden has awarded the work of midwives in Uganda at a residence for many years, and I have done that for 4 years to get together with Maria, who was awarded a lifetime award here. So I was very happy to see her here tonight, and I have personally seen her passion and commitment for this, and also, of course, Macarere, a historical partner to us. So, as the time is late and you must be starving and tired and very anxious to maybe spend some time and celebrate in a more informal setting, I will maybe stop here and again just assure you all that Sweden remain committed partner to Uganda when it comes to health, when it comes to maternal health, infant health, and to ensure that women have an equal standing, and that when women and girls thrive, communities thrive, and let us continue working together to safeguard motherhood, strengthen health systems, and build a healthier world for generations to come. I thank you very much. I hope you had very good 3 days, and I wish you a festive evening, and I look forward to continue following the work all of you are doing. Thank you very much.
And thank you, Your Excellency, once again, and all our partners. I think the next agenda item is our dinner. And our dinner is ready. I'm told you have coupons. Dr. JP, step forward and where exactly? It's where we had last year?
Yes, thank you very much indeed, Commissioner. So we will be proceeding to the Sunset Restaurant. You have those invites, they're digital invites. The restaurant where we've been having lunch from, that's where we should proceed for the dinner. I would request our awards team, Divine,